everybody is important. So I would like to welcome everyone that is here one after the other as we linger a little bit, because today is the first day, and I'd like to crave your indulgence. We would not just start right away. Let's exercise a little patience, maybe from now till 5:10 or thereabouts, or 5:15, because other people are trying to log in. I've had a couple of people call and they're about to join us. So please, I crave your indulgence. Let's just bear with them a little, since today is the first day, but after today, we will not give this grace. Thank you. So it's nice to have you, Jovita. I'm so glad that you are here with me this evening. And
Thank you, ma'am.
I trust you are doing great.
Yes, ma'am. Fine. Thank you.
Okay. Abolarin Abidemi.
Yes, ma'am.
Nice to have you. Nice to have you. Thank you for coming. A wise lady once said that if you pass through a particular road and that road is good, you didn't have hitches on the way, you enjoyed your trip on that road, you will gladly want to go through that same road again and again. So that's why I have some of you here, Jovita and Abolarin. You're welcome. It's nice to have you again. So
same here, ma'am.
Okay, so Christiana, it's clear that I think you are joining us. This is your very first training with us. So I want to welcome you. Well, I want to give you extend and welcome you here with us. You are welcome, and I trust that you would be amongst the next set of people to testify when we are done with this training. Christiana, can you hear me? Christiana, okay, we cannot hear Christiana. Please hear, those that have worked with me before know that I like to hear everyone's voice. I like to hear everybody talk. I like to hear everybody talk. And because it gives me the strength I need to move ahead when I hear people talk. I didn't hear from Christiana. Maybe she would say something much later. Then, Kate, Paul, are you here, Kate? Hello, Kate. I guess it's not network, because good evening, Kate. It's nice to have you here for the first time, having it with Andy Smart Solutions. It's nice to have you here. Yeah, welcome. And trust me, just trust me when I say so, you are in the right place. You know, many of us have been, there are a whole lot of people on the platform that would have wanted to take this training, but because we know how good our society is, so some of them are still doubting and still saying, is it right? Should I go forward? These people will scam us, they will take away our money. Oh, I don't, and a whole lot. So I understand these things, but I want to assure you that you are in the right place. Be rest assured. Thank you for being here. Aminat Aremu. Good evening. Aminat, can you hear me? Okay, maybe Aminat will join us. She would say something afterwards. I would have really loved to hear her voice, because she's one of those that have been asking questions on the platform. So I wanted to hear her voice, at least for the first time, but no problem. We move. Mildred, yes, the very, very serious student. Hello, Mildred.
Good evening.
Good evening, my very, very serious students. It's nice to have you here, Mildred. I love serious students, and I'm glad that you had to put us on our things, saying you need this. I just need to have everything before that time. And it was glad you asked for that at that time. Thank you for being here with us. Okay, Aminat, I just saw your face. Aminat, are you ready to say hello? We are just buying time. When it's 5:15 dot, we are going to start. So let's use this few seconds for formalities.
I'm with you. Can you hear me?
Yes, I can hear you. Aminat, how are you doing?
Fine, ma'am.
It's nice to have you. I wanted to hear your voice because I used to see Alege Shola, you know, on the show. I said, let me hear this lady's voice that has really been asking me questions. You are welcome. It's nice to have you, Aminat. Okay. Suzanne, Olaruwaju, that is another person that has decided to take the same road that she took before because she enjoyed it. Hello, Susan. You're welcome, Susan. It's nice to have you. I think you were the very first to be here. Okay, Susan is not responding. Omowumi Adesoye. Omowumi, hello, Omowumi. Okay, anybody that does not respond, perhaps much later. Mr. or Mrs. or Miss Osareme Akenuwa. Can you
Yeah,
hear
I can
me?
hear you.
Okay. I hope
Yes, I can hear you.
I hope I didn't butcher your name. Am I correct?
Not at all. Yes,
Okay.
you're very correct.
Thank God. All right.
Good
Welcome. It's nice
evening.
to have you.
Thank you.
It's
Same
nice to
here.
have you. Yeah. Promise Nwagu. Hello, Promise. Okay. Maybe Promise is still not yet fully with us. Okay. Uchenna Juliet. Hello, Juliet.
Hello, good evening, ma.
Good evening, Juliet.
Hello, good evening. Yes, ma.
I can hear you. It's nice to have you, Juliet. You are welcome.
Thank you
Okay,
so
I think
much.
I have
Thank you,
not,
ma.
you're welcome. So I guess I've not omitted anyone. There's a Xiaomi here, 23129. Please, who is using that device? I like to acknowledge everybody because everyone is very important to me. Who has that?
Some are experiencing network issues.
Challenges.
Those outside Lagos and Abuja. Yeah.
Oh, that's
Somebody
so
called
sad.
me from Ogun State. Said she's experiencing network issues.
Oh, that's so sad.
That was
Why
nice.
now? Why today of all days? Please, let's plead with the network to favor us today. I'm so sorry to hear that.
Amen.
But nevertheless, as I said, we'll try to, they should just be rest assured that they wouldn't miss any parts because we are going to have the slides and the recorded versions. And then we just pray that the network will align. Thank you so much, sir, for bringing that to my notice. I appreciate. So, who is left? I hope I've done justice to everybody. Those, Nora. Hello, Nora. Good evening, Nora. Okay, maybe as we progress, this is 5:15. As we progress, I would acknowledge others that join us. Okay, Damilola Omolara, you're welcome. Okay, without wasting time, I want to seize this opportunity to thank everyone once again for being here today. It's not an easy thing for you, first and foremost, especially those that have not had any training at all with us. So
sorry, this is Omowumi. Good afternoon, ma.
Okay, Omowumi, you are welcome. It's nice to hear your voice. Nice to be here.
Yes,
welcome.
ma. Thank you, ma. Yes, ma.
Right. So let's go ahead. So as I was saying, it's not really easy at this point in time to trust a person online, regardless of the fact that we have our website and we have everything. But I want to thank you all for trusting in us, for believing in us, because that was the first step. If you did not believe in what we were doing, if you did not believe in us, you would not have registered in the midst of what is happening in the society today. But what I want to assure you is that you will be glad you did. That's what I want to assure you. You'll be glad that you actually took this training at the end of the day from Andy Smart Solutions and NJB Management. Okay, so I'm just going to share my screen because we want to talk. Today is the first day of the training, and as it is my practice, I like to let people know what they should actually expect. Let me share my screen. Good. So we can all be on the same page. All right. Now I need to find out, can you see my screen? Is it clear?
Yes, ma'am.
Yes,
Yes, ma'am. It is clear.
Okay, thank
Yes,
you.
ma. Yes, ma.
All right, so as I was saying, I want to believe that in many of us, just we may have our different reasons why we decided to venture into the health sector. Because over the years, I've had people tell me very interesting stories. They've told me a couple of things that have motivated them. Some of you, like when we tried looking through your form, some of you are people that don't have any background knowledge in health. Some are teachers, some are lawyers, and so on from different walks of life. So, but you've decided to delve into the health sector, of course, and obviously it should be for a reason. So before we continue, I'd like to ask you, before I tell you my own story, or a brief story of how I actually delved into what made me go into the health sector, I would like to hear from you. So while you think about what you are going to say, let's be on the same page concerning the rules. In terms of talking, we only speak out, we only talk when we need to, which I encourage. When it's time to talk, when a question is raised, please let's contribute. This is not a bottled up training. I don't like to do bottled up trainings. Rather, I prefer to teach. That's what I like to do. I like to teach, and I like to make it as simple as possible so that everyone can understand, regardless of whether you have the science background or not. So we are just going to interact. We are just going to discuss, share, rub minds. I'll learn a lot from you as well as you learn from me. So it's a give. It's a two-way thing. So also concerning the course outlines, like we are going to see, I took my time to break it down in the WhatsApp group so that you'll understand. We are going to be taking 3 modules per session. Each session we have will take 3 of those modules. Now, health courses are interrelated. For those of us that have taken the CNA trainings, you'll discover that maybe 1 or 2 things may be related. Why? Because it's still the same, it's more or less the same duties you perform, but not the same. Take note of not the same. It's more or less. So you see 1 or 2 things that are intertwined, but you see a whole lot of things because a CHCA has a broader spectrum than a CNA. That's a certified health assistant has a broader spectrum than a certified nursing assistant in terms of scope of practice. So you get to learn more on this training. Now, if I may ask, I would like someone to share, maybe just to share an experience or to tell me what actually motivated you. Why do you want to go into this particular field? Or why do you want to maybe move from where you are into the health sector? So, like I said, I like to hear from people. I like it to be, I like us to discuss. So please, who is going to help us? Who is going to build the cat? Who is going to help us? Who's going to set the ball rolling? Hello, can everyone hear me? Please, I want us to
Mildred.
Good, beautiful, Mildred. Mildred, go ahead. I actually wanted to call, you see, so that means you are in the spirit. I actually wanted to say, okay, who did I see the form or something? Okay, let me call Mildred, but thank you that you opted out to answer before I called you. Go ahead, Mildred, share your experience with us. Thank you.
Okay, I can tell you that I missed it initially because I've actually always have flair to care for people and take care of people, sympathizing with people and all that when I was growing up. And my siblings, aunties, uncles like that, they've advised me when I was in secondary school that I should go for nursing. I refused. Okay, going to healthcare, no. I was looking at the money in the banking industry. I went and studied banking and finance. So, but at the end of the day, I actually studied banking and finance. I worked in the bank for 10 years. I was tired of the industry. And I discovered that life is not all about what you intend to gain from a course, but what are you going to give out from whatever you are studying?
That's correct.
Even in the health sector, there's still a lot of people make a lot of money too. But the most important thing is, what are you what is your input, not actually the
to
output.
the
The output is the
society.
financial
Yeah,
aspect.
yeah,
Yeah.
that's
What are you
right.
giving out? Yeah. What are your, when we talk about social responsibility is not just for governments, it's also for us individuals.
Everyone, yeah.
So I came to realize that the health sector need help. They still need a lot of people. And I can tell you from my experience, I have taken care of kids, my sister's children. I've followed them to the hospital where they put to bed and all that. And I discovered something. There are a lot of people in that environment that are not supposed to be there. Because you can't be a nurse and be wicked. I saw a lot of wickedness in different hospitals and all that when my sisters were putting to bed.
Yeah.
So I now discovered that, I now looked at myself. I said, you are blaming them that, they are this, they are that. But you are supposed to be there to make an
give
input.
your own part, yeah.
Give your own part, and also enlighten people why this should be, why you should study that when you're going into the healthcare environment, you have to be sympathetic, you have to love what you're doing, you must have flair for what you are doing, because a lot of people don't have flair. That some are just looking at, let me study and go to the US and make money. Let me study and go to the UK and make money. But do you have flair for what you are doing? That's why a lot of certificates are being seized today from nurses and medical doctors abroad. So why I'm coming into the system is that I've now discovered that caring for people is more important than what you are trying to gain. I want to come in to make changes, like making them, like talking to people, creating awareness on how the healthcare system, the healthcare environment should be run. That is what I'm trying to do. That's where my background. That's why I'm changing from management, banking now to health. Thank you, ma'am.
Beautiful, beautiful. Wow, Mrs. I don't know if I'm correct. Mildred, thank you. Beautiful, beautiful response. I love that. In fact, you've just taken the wind out of my mouth. You've left me with nothing too much to talk about in this introduction.
Thank you, ma'am.
Thank you for that. Actually, what you have said is perfect. We have had such issues occur. We've had it, we've seen it firsthand, we've seen it happen to our relatives, and we've seen a whole lot. Thank you so much, Mildred. I appreciate that response. Please, who else? Do we have someone else? At least let's have another person that would...
Okay. Good evening,
please.
everyone.
Good evening. Good evening.
Okay.
Please tell us your name.
My name is Kate.
Okay. Kate,
listening to this from Lagos State. So I actually want to contribute while the reasons why I want to participate in this healthcare assistant job. The thing there is that right from time I've actually loved helping people. I've actually loved mingling with people. And I think that in this country, there are people who are financially buoyant and mostly feel they are passionate for people by like giving the money, thinking, okay, just get this, you can sort out your problem. But when it comes to people like us who does not have that money, for example, to say, let me go into the financial aspect, it happened that there are certain...
Are you sure?
Yeah. Yes, ma. For now, not up to that level.
Go ahead.
Okay. So I have this passion to in rendering help to others. I have this, for example, when I see your situation, I have this, I'll have this sympathy for you. And how can I come?
Yeah.
Yes, I sympathize with you in your situation, but how can I render help? There is no how if you are looking at a financial aspect, but the only way I know that I can actually render help to them is by coming into this healthcare assistance, which it will help me to assist you if you are in need, maybe you in terms of your health issue. And then secondly, it will equally help me to mingle with people, because if we enter into the nursing, into this field, you will know that people have different characters. And if they are not a patient type and somebody that you can, as in, get yourself together with any people you find yourself, you can't. And me, I'm this person that no matter where I find myself, I think I can find my way around it. So it's my passion and my dream to be in this field.
Wow, thank you so much. Kate. That's a one beautiful answer. Splendid. Thank you. Thank you for those responses. I know that everyone here, for one reason or the other, have ventured into this field if they are not already in the field. So they have their reasons, and which I believe are cogent reasons. So, but for the two that have responded, I want to say thank you. I don't know if there is one last person or we can move. Is there any other person? Just one more and then we go. Any other person, please? Okay, maybe let's move. Now, before we even go into what we have, like I had said earlier, I want to believe that before you accepted or before you opted out from wherever you are or you delved into this health sector, you must have your reasons, like we already said. But I want to tell you something, like I like to tell everybody, I like to tell people that getting into the health sector, taking care of vulnerable people, taking care of people that need your help, taking care of people that ordinarily wouldn't have been the way they are, but life has just played on them. That's why they are like that. So it is very important that you make up your mind. It has to start from you. That's the first thing. I have just some few things to say. Imagine, let's look at this. When I first started, when I first entered into the health field, like Mildred said too, I wasn't in the health field originally. Before I delved deeper, acquired more certifications, went higher and further, I used to just help because like passion is everything. I have the passion. So for anyone to say you want to be in the health sector, you want to be a certified healthcare assistant, you want to be a certified nursing assistant, you want to be a caregiver, you want to be a nurse or even a doctor, anything you do in the health sector, you have to be passionate about it because it is not a walk in the park. I tell everybody, it's not a walk in the park. It's not rosy. You are going to, of course, find bottlenecks. You are going to, of course, have challenging situations. But what will actually keep you going is that passion that you have. That's very important. So you have to have patience. You have to be sympathetic towards another person. You have to learn how to feel the pain that a person is feeling for you to be able to perform, to function maximally in this particular field of care. It is very, very important. Now, over the years, I began to see, or I've seen different scenarios before I actually went into the health sector. I've seen different scenarios. I've seen people that are handled by healthcare assistants or caregivers that weren't sympathetic, that were not patient with them. I've observed the A part and I've observed the B part. And I have come to know one thing with the knowledge I have acquired. I've come to know one thing, that the manner with which a person is taken care of when that person is vulnerable would definitely go a long way in helping that person either getting better or getting worse. That's what I want you to thank God. Mildred already said that. There are situations you see people being treated anyhow. People are treated with reckless abandon. These are vulnerable people. These are people that need your care. Perhaps people with dementia, people with bipolar disorders, people that maybe have one issue or the other in their most vulnerable state. So if you have the passion, you will keep forging ahead. You would help. You would do everything you can do with patience, with love, with compassion. If you're a temperamental person, then it's not the right place. Like I said, over the years, I've had people that they are just, oh, can I use this? Can I relocate abroad? I want to travel abroad. I just want to get a job. I just want to go here. I just want to do this. But I tell them that getting a job, fine. We all want better. We all want to go over to the side where the grasses are greener. We like to go there. But the fact remains that you just going over to take a job that for the mere fact that you want to be in that other part where the grasses are greener would not take you very far. But if you combine that with the passion, you combine that with that empathetic nature of yours, you combine it with having humanity in view in whatever you do, the sky will not be your limit. It will just be your stepping point. So practically, that is what. So this training, I want us to just prepare our minds. I want us to prepare our minds because we are going into a journey. Now we are embarking on a journey. We are embarking on a journey, a profound journey that goes beyond the clinical skills. Now, this training is not only going to be about how maybe you clean up a person that has just been given an injection, or the clinical aspect of it, dressing wounds, doing this and doing that. No, it's not only going to be about that, you know, but it's going to be about everything, the conversation about giving comfort, offering comfort, spending your time with patients, making them to have a meaningful experience. That is the most important thing. So as a CHCA, as a healthcare assistant, you hold the power, you have this power, you may just take it lightly, but you have the power to transform lives, not just through the medical support, but through compassion, through empathy, and through genuine human connection. So as you are taking this training, just how do I put it? Begin to condition your minds. Just begin to tell yourself that if I am going to be in the health sector, if I am going to have the opportunity to work with vulnerable people, to work with people that are sick, to work with people that need my help, to work with people that cannot do things for themselves, then I have to wear all the attires. I have to put on all the things, all the skills that I would need in order to function effectively. Now, just picture yourself maybe as hope, as a beacon of hope for those that are in need. Someone that can turn fear into reassurance and isolation into companionship. So you have a lot of work to do as a certified healthcare assistant. Throughout this course, from the beginning up until the end, if you have taken time to go through the course outline, you would see that it is packed. It has different parts, different corners intertwined together, molded together to ensure that you come out to give that efficient care that we are looking for. In the health sector, in the hospitals, just as Mildred said, in the hospitals, you get to see so many anomalies there. You get to see so many things happening that should not be happening. And then you just know, someone like me, I know immediately that this person is there for the wrong reasons, or this person wasn't meant to be there. I just know that when I see such behaviors. So because the way you handle those people, the way you treat them, the way you show them love, the way you show them compassion, the way you show them empathy, it makes them feel better. It makes them still feel relevant, even in the state of that illness that they have. So we are going to look at it. No need to, I just wanted us to prepare our minds and to know that a lot lies ahead of us. So let's move to this slide, the course outline. We are going to be taking 3 of the modules, like I already said, and we are going to be having breaks intermittently because we are caregivers. We don't want to resort into first aid or maybe giving virtual first aid to anyone that sits for too long. So we are going to have maybe 15 minutes break or 20 minutes break when it's that time for us. I think by 6:30, we'll take our break. So we're going to have 20 minutes break so we can stretch our limbs a little, we can walk around, and we'll be back for the next session. So, but for now, this is the course outline. Like you can see, these are the things we are going to be looking at. Now, what is healthcare? We've been talking about health. We've been talking about health. What is healthcare? Very important. Now, healthcare talks about.
We'll talk tomorrow because my mind is here. My mind is be sure.
You see, we've just said something about muting our mics until when we need to speak. Please and please, let's do the needful so that we don't get so that we can move with the time, move and use the time judiciously. So healthcare simply refers to provision of medical services, just as you can see here on the slide, attending to people that need patients, people that actually need care. And this care is made available to them. That is just the A to Z of healthcare. Taking care of patients, providing medical services, taking care of them, also handling the emotional aspect. Everything put together is what we refer to as healthcare. And then, why do we need this healthcare? Why do we need proper healthcare? Why do we need to take care of people that are vulnerable? Why do we need to take care of the people that are ill? Why do we need to take care of people that actually need help? Why? That is the purpose of healthcare. So it is important that we get it right from the start. The reasons why people should have access to good health care. The reason why people should have access to comfortable care when they are ill, when they are in the hospitals, just as Mildred had earlier said, the need for us to understand, to to show respect and to show love while dealing with these people. Because first and foremost, when we understand that these people were, first of all, people that had their lives. Take, for instance, maybe a person that has dementia now. I like to talk about dementia because it's very common. It's skyrocketing these days. So look at someone that maybe suddenly has dementia. And you as a healthcare assistant, maybe you're attached to someone that has this particular illness, dementia. It will be a bit difficult if you are not trained, if you don't have all the communication skills, if you don't have all the skills, compassion, patience to relate with this person, you will have hitches, you have bottlenecks in the course of your rendering care to the person. But when you understand that the person was first and foremost a normal person with his or her own life intact, had the social aspect of life, had the spiritual, had the physical, had friends, had families, had a good job and all that. And all of a sudden, life has now relegated that person to that particular position. So if you understand the dignity that should be attached to that person, then you look beyond whatever challenges you face, you look beyond whatever is happening to that person, look at that person first and foremost as an individual. So the reason why we need to give proper health care is to promote and to maintain, to help restore health. Make sure that to help people maintain good health, even those that maybe along the line, they are having challenges with their health. If you know exactly what to do, you can help them to restore their health. They can, with the manner with which you give them treatment, and the manner with which you attend to them will help them to recuperate faster, will help them to get better. That is one of the things you need to know. As we progress, we are going to look at the importance of, or the duties of, a certified healthcare assistant. That is where we are really going to delve into, dissect it one after the other, so that even as you are on this platform, like I said, today is the introductory part of it. So we are just going to be looking at the surface. As time progresses, we will take each of those modules and delve deeply into it before we get to the practical. So brace up yourself. This training is actually packed. In any way you look at it, it is packed. For those that had reservations saying, oh, how do we do the practicals? How do we get to know how this is done? How do we get to know how that is done? They will be shocked. How I wish they were here to see as we progress. So that having said, we have looked at the very introductory part, what healthcare is, organized provision of medical services, what is needed in a particular facility, what we need to get in a particular place is what we are going to look at. So right now, as we can see on this slide, we have different types of healthcare. We have different types. It is important we know that, because as healthcare assistants, we need to know everything about health. We need to know, because when we know, we'll be well guided. We'll understand how we can relate with these patients depending on the particular setting that we find ourselves. It could be in the hospital, it could be in a care home, it could be in a residential facility where you need to attend to someone that needs care, someone that is vulnerable. It is important that you know the different stages, the different types of healthcare that we have. Like I like to do, I don't like a training where I'll just be talking and talking and talking. No. Okay, thank you, Mr. Ahmed. It's nice to have you. I like to go through the chat box. And I've seen Mr. Ahmed. Okay, I think we have reminded ourselves to mute our mic. So please, can everyone see me? Because it's a sickness. It's another kind of illness for you to just keep talking to yourself. And you don't know you're talking to yourself. Perhaps you assume that you're talking to people and network does not allow the people to hear you. So intermittently, I'm going to be pausing to ask if you can hear me. Please, if you have any questions, do well to put it in the chat box. Are we together? Can everybody hear me, please?
Yes, I can hear you.
Yes, ma'am.
Yes, ma'am.
Yes, I can hear you. Just that my network is a bit breaking.
Oh God, please, network, please, please, please help us today. Okay, thank you. I have heard a couple of people, I think 3 or 4 people that can hear me. It's only unfortunate that only 4 people can hear me. Okay, thank you.
I can
So
hear
let's
you,
go ahead. Thank you, thank you. Let's go ahead. So we want to look at the different types of health care. The different types of health care that we have. We have the primary health care. That's the first, the primary care. Now, what is the primary care? When we say primary care centers, primary health care, what are we looking at? As it is here on this slide, is the first point of contact for individuals that are seeking health care. It's just the first point of contact. It is usually provided by general practitioners, maybe family doctors, maybe you just have a maybe you have constant headache, or your child is not feeling well, or your husband is having maybe malaria or something. The first place you go to is to go to the hospital. And of course, you may want to see a general practitioner. That is primary care, where it's easily affordable. Anybody can just reach out to at any little. You have pains in your teeth, go to the care. Now, what are some of the services that they render? This primary care, remember, like I was trying to tell you, is the first point of contact for individuals that are seeking health care. What are some of the things they do when we look at primary care? What are some of those services? It could be like routine checkups where you need to go for checkup. Yeah, you feel you just have to go and have a routine check your health, the status of your health. Vaccinations too, where you go to get vaccinations. Maybe you need to be vaccinated, polio vaccine, give your children polio vaccine, or give one vaccine or the other. That is primary care. It could equally be maybe treatment of illnesses like colds or flu. Maybe when you have catarrh, you have flu, you have cold, you just go to the hospital, see a doctor, see not a dentist. A dentist is for teeth. You go and check yourself. That is primary care. Now, what does it actually focus on? Why does it matter? I want us to understand so that we'll be able to know the difference between the 3 healthcare groups: the primary care, the secondary care, and the tertiary care. So we are talking about the primary care now. We've talked about the examples of the services that you can get from a primary care health center, like checkups, like vaccinations, we already talked about. Why does it matter? Now, primary care, I want you to understand so that you'll be able to differentiate between the 3. Remember that we will be having a professional examination soon. So questions can just come from any angle. That's the way they go ahead. The board exams comes like that. So you have to be attentive to details. So primary care focuses on the overall health and wellness of a person. Your overall health, your overall wellness. It helps you prevent health issues before they become serious. That is very important. It helps you because if you just feel small symptoms, you go to the hospital, that is a primary health center. And aside yourself knowing the differences, you also need to know, because you can be a healthcare assistant that is attached to a primary, under the primary care setting, or you may be attached under the secondary care setting or the tertiary care setting. So it's important that you know these things so that you are able to distinguish them. Now, for the primary care, it helps you prevent issues before they become serious, and it ensures that patients receive continuous care, continuous follow-up, continuous care. Maybe you go, you have flu, you are checked, you are given your drugs, you can go there for checkups and so on. They keep tabs of how you progress as regards the challenge that actually took you to the hospital in the first place. So that is primarily all that there is about the primary care. Now, we move to the secondary care. The secondary care includes specialists. This one is advanced, is a little bit advanced. It refers to specialized medical services that may be referred to after seeing a primary care provider. That is the secondary care. For instance, maybe You have maybe you have bone issue, maybe you've been feeling pains, you know, your back. For some of the women, you know, some women mostly have waist pain and all that. Maybe you've been feeling this waist pain for some time, and you decide to access your primary care center. You get into the hospital, you see the doctor, and maybe in the course of checking, they find out that it is more than meets the eye. Like, you need to go higher. You need to progress from the primary care onto the secondary care so that your bones can be checked. Very important, so that you can see a specialist that would have maybe an orthopedic doctor that will look at your bones, check, maybe have an x-ray to see what is giving you the severe waist pain and so on. So secondary care deals with specialists, such as maybe the neurologists, the oncologists, the people that will actually have, there's actually specialists in a particular field, not so common fields. Anyway, so that is the secondary care. So it's not just the go-to. It's not just the go-to place when you just have a little illness. No, that is the secondary care where you actually see the specialist. So the specialist will now do a whole lot of work on that patient to be able to ascertain, to be able to diagnose, to be able to finalize and know exactly what is the challenge that that patient has. So that is the secondary care. Okay. For instance, too, under the secondary care, maybe you have heart issues. Of course, you go look for a cardiologist. You go look for someone that will be able to access, check, maybe they do an x-ray, maybe do a scan, and then you are told this is exactly what's from there. It is the cardiologist that will carry it up, that will carry on from there to check you and then follow up. That is the secondary care specialist. Take note. Now, and then, or you have skin issues. Maybe you have skin issues, you have some skin issues. You go and see a dermatologist. That's a specialist. You don't just go and see anybody in the primary care center for you to be treated. No, you are referred to go and see the person that his or her duty is specially for that particular purpose. Take note, I am trying to explain to you so that in any situation, any of those care centers you find yourself, their healthcare assistants are located that would help the patient. So how best can you help the patients other than you knowing exactly the differences between these places? So you know to the extent that you can actually render help or service to the patients, depending on the position, the location, the group that you are asked to attend to. So why does it actually matter? Secondary care provides more specialized treatment, like I already said, for conditions that require more expertise than what the primary care doctor can provide. That is where the secondary care comes into play. So we have talked about the two. Now we've talked about the primary care, the first go-to, the first point of call or contact when you have mild situations or mild illnesses. And then the secondary care deals with specialists. And then the last but not the least is the tertiary care. Now, tertiary care is highly specialized, is a highly specialized care situation whereby the people that are most likely in the tertiary care health centers or where they are given tertiary care are people that are maybe their treatment goes beyond just the specialized care. It goes beyond. Maybe people undergoing operations, people that are having, maybe they have to have maybe kidney transplants, where they have to do real heavy procedures on them in order for them to get better. That is where the tertiary comes into it. Major surgeries, advanced imaging, maybe like cancer treatments or organ transplants, all those ones are heavy. So they are not the ones that, those things are not things that can be handled within the primary care setting or within the secondary care setting. So it has that particular patients or patients have to be moved to be under the tertiary care department or setting, whereby they would have all the facilities, all the equipment, everything needed to have the minute by minute monitoring of that particular patient. So this is practically the difference between the three care, the primary care, the secondary care, and the tertiary care. This is very, very important. So in one sentence, I'm just going to, because I'm going to ask you at the end of today, what I like to do is you tell me one or two things that you have actually learned from today. Something that stood out for you, something that you took home with you, because since we are highly knowledgeable personnel and people on this platform, you may have, okay, someone is saying I should talk about, okay, Kate, that's good. Network is disturbing. All right, so Kate, I have seen your message. Like I said, I keep going through the chat box. Kate is saying I should please go ahead with the, come again with the tertiary care that her network disturbed. Okay, what I mean by tertiary care in a nutshell setting is, is a specialized setting that is meant for advanced treatment. That a treatment that goes beyond the specialized care. Maybe people that have to go through heavy procedures, surgical procedures, like kidney transplants, like cancer treatments, like organ transplants, like I said, imaging, and so on and so forth. So that aspect is where people that are undergoing operations are kept. They are handled in the tertiary care setting. So in a nutshell, primary care is your first stop for general health. That's all. You just need to, maybe Mr. Mohammed just needs to go and check himself. After being underwater for 6 months somewhere, he may just come out and say, oh, let me go have a checkup and just be sure that I'm fine, be sure that I'm good. So he will have to go to the primary care setting, just walk into the hospital, and not much work is just given the necessary things. But when it gets to a higher stage where you need to a specialized doctor to check, maybe to check your teeth, a dentist, maybe a neurologist to check you, that's the secondary care. And then when you have to deal with people that are having surgery, that have to be checked, maybe their blood pressure has to be monitored to get the effective time for them to actually carry out a particular surgical procedure, maybe kidney transplants or anything, those ones fall under the tertiary care setting. So it is important for us to understand the differences between these three so that we can better serve our patients. We can better render the help that they need to our patients. So I don't know how many of us is able to hear me, because I'm glad that at least we are up to 20, even though we should be about 25 or 28 participants. Please, can everyone hear me? Are we together? Do we understand the different healthcare settings?
Yes.
Yes,
clearly
we do.
understand.
Okay. I am a very patient person, because you know that the caregiving itself, the work itself, the healthcare assistant duties itself requires patience. So I am trying to exercise that. I'm trying to be patient because I want everyone to.
Please, can you hear me?
Yes, I can. I can hear you.
Okay, please, let me ask this. Should I be, okay, question to understand very well. You, concerning the three differences between the primary, secondary, and tertiary healthcare.
Yeah.
So you made mention that the primary has to do with the first point of contact. For example,
That's
I have
correct.
headache and I want to rush to the hospital to know what is happening. And then
that's correct.
Yes. So the secondary, you talked about that it has to deal with with a specialist. Example, I'm having chest pain. They would direct me to a cardiologist in order to examine to.
Hello, Kate, I've lost you.
Hello. Please, can you hear me?
Yes, I'm hearing you.
Yes, can you hear me?
Yes, I'm hearing you now.
So the secondary has to do with maybe, for example, meeting a cardiologist in order to diagnose, to know what is wrong with my chest or any part of the skin problem or anything. That is for the secondary care center, right? And then the last, not the least, which is the tertiary, has to do with there is above specialists. For example, when it comes to surgery, kidney transplant, and the rest.
Heavy advanced surgical procedures. Yes.
Okay, thank you very much. I wanted to know if I'm following.
Kate, you are following. You're another serious student. All right. So can we go ahead, please? Are we on the same page, everybody?
Yes, Maria.
Okay, so let's move. Let's move to, so having said that, those are the primary, there are different healthcare settings that we have. Now, key roles in healthcare, like in the healthcare setting, we have roles, you know, people do different things. What your duties as as a healthcare assistant is different from the duties of maybe the nurses and maybe the doctors. You have your own duties. So we in just few sentences, like you can see on this slide, these are the duties that these different healthcare practitioners do. Remember, when I started, today, like I said, is the first, is the introductory part of this training. If you look at the modules, you see that as we progress, we are going to delve deeper into these things one after the other. This training is packed, and it's unfortunate for those that missed it. Let me say, missed it not because they didn't have the finances, but because they were still doubting, like being the doubting Thomases. So, but I am glad that I have a good number of people that will move this journey with me, that will move with me through this journey. So on this particular slide, we have the healthcare providers, we have the doctors, we have the nurses, we have the therapists, we have others as well. Now, they have their own different duties that they do. We have the healthcare assistants that support our providers in delivering care. You support a healthcare assistant. We are going to get to the roles and the duties of healthcare assistants. Your primary duty is to support. You support the other healthcare practitioners, like the doctors, like the nurses. You play a very critical role in the health team, a very critical role. You get to understand that as a CHCA, as a healthcare assistant, you touch the lives of the patients even more than the doctors and the nurses. You are closest to them. You relate with them one-on-one. And because you are closer to them, that is the essence why you really need to have all these qualities at your fingertips, because you interact firsthand with them. And for you to help them to actually come out better, to actually recuperate faster, to actually heal faster, you have to be on top of your game. We are going to see that, God willing. I think tomorrow we have the patient communication skills. So when we get there, that is where we'll take a lot of time, because I like to be very, very passionate when I talk about that, because I have seen it all. I have seen it all in whichever way you look at it. I have really, really seen the way patients are treated. I've really, really seen the breakdown in the health sector in terms of maybe in the hospital and then the patients, or the health workers and the patients. I have seen it all. And I'm always very passionate when I get to that point. But nevertheless, let's look at this. Administrative staff, you know, they manage the operations and the patient's records as well. Ensure that you monitor, you keep tabs on the patients, you handle the records, you are able to really understand what you are actually expected to do. You follow up with the patients, you look at the medications, you ensure the patients take their medications, you document, you report. There are a whole lot of things. So a CHCA, you have a whole lot of work to do. So now, having said that, let us look at the importance of healthcare assistants. Importance of healthcare assistants, or the role that they play. Now, at this point, I'm going to be this is where I really take time, because this is the icing on the cake. For you to be a healthcare assistant, a successful one at that, you need to first of all know what your responsibilities are. Why are you important? Why are you invaluable? Like we kept saying when those ads were being placed in the group, I did say that as a healthcare assistant, that you have a broader spectrum. For those that have talked to me, I made them to understand that your duties are broad. You have a broader scope of practice than other caregivers, because as a healthcare assistant, you are a caregiver. So you have a broader role to play. Now, let's look at some of those things, why you are highly important, and why in the soonest possible time, HCAs will not lack jobs. I'm not talking about jobs. anyway, because we don't give jobs. Like I said on the platform, we don't give jobs to anybody. We are not for recruitments, into recruitment or traveling. We state it clearly to everyone. But what we do is we equip our participants, we mold them, we give them everything, just as we are giving you the mental health awareness certification and giving you that training still in this program, so that you'll be well grounded, you'll be well molded in anywhere it's going to come out, anywhere they'll bring any interview under the surface of the earth for you. So long as you pass through this training, you will be ready. You have an edge over the other people. So it is very important for you to know how important you are. What are the things you do? Now, one of the duties of a healthcare assistant, or one reason why you are important, is because you direct patients' care. You help patients with personal care tasks. That's one of those things that you do. You help them with their personal care. They call it activities of daily living.
Okay, so when I lost my father, right?
Okay.
Who
is talking? Nora. Hello, Nora.
Sorry, I muted. Please go ahead.
Oh, no. Were you saying something? You said when you lost your father, were you talking to us or talking?
Not at all. Not you at all.
Okay. Because we've heard so many stories. People have really shared their experiences with us. So when I heard when you lost your father, I know it's related to what we are doing. That's why I paused for you. But no problem. Since it's not for us, it's fine. So you assist patients with daily activities, such as bathing, dressing them, grooming them, and feeding them. You monitor their condition and you report changes. Now, let me pause at this point. There is nothing that is as important to a person as activities of daily living. The things you do every day are very important to everybody. It's very important because they are a part of you. They are things, they are things that you cannot, for any reason, you wouldn't be very happy to allow another person do those duties for you. I'm driving at something. I want us to rub minds concerning this and really understand. If, as you are, I think like Mrs. Ugweze Nwachukwu, that is right there with us on this platform, she wouldn't want someone to do the bathing for her on a very fine day because they are personal things. She wouldn't want someone to maybe feed her. So these things are things that, as a CHCA, you assist your patients with doing these things, these very personal things. So in the course of you doing these things, you need to understand that these people, you have to preserve their dignity, because once the things you could do for yourself personally, you are not able to do it for yourself again personally, you now need the assistance of a person. Automatically, if that person does not do it with in a dignifying way for you, you will feel so bad, because those are your personal effects. Those are the things that are personal to you. So as a healthcare assistant, you assist with these things, with bathing your patients, with grooming, like combing of the hair, maybe feeding, and doing a whole lot of things. And you also monitor their condition and you report changes. So you see how important you are? In doing those things, you are actually doing a critical job. You are actually doing something that is critical. And in the course of doing these things, you have to do it with love. You have to do it with understanding. You have to do it ensuring that at no point should your patient feel less dignified. In some cases, in some settings, that's why we are having this training. I have really seen how patients have been treated anyhow by nurses, by maybe CNAs, by maybe HCAs. They have been treated anyhow. And because they've been treated anyhow, they make these people, these patients, these vulnerable people feel less of themselves. That is not what we want to happen. That is not what we want to happen as people that will be highly knowledgeable by the time we pass through this training. So when we do these things, we should do it with all level of respect, with all level of compassion, of all level of empathy, and also ensuring that we don't make our patients feel less dignified. So this is one importance of HCA, of a healthcare assistant, and one of the major duties that you need to carry. Sometimes you may have patients that maybe are bedridden. So part of your duties will be maybe cleaning them up, tidying them, as we would see in the practicals. Like I said, that practicals, we are going to see everything. We are going to dissect it. We are going to see these skills. We are going to learn how to do them. So you will even see how to take care of a bedridden patient. You see what to do, how to turn, how to feed, how to do the necessary things when we get there in a very respectful manner, so that the person does not feel. So that is one of the duties, direct patient care. You assist them with this task. Your support is very crucial for these individuals too, with reduced mobility or those recovering from surgery. So you see, you have to put on, learn your skills well. It could be someone that just had a surgical operation, operating from a stroke. So you know how to handle, how do you dress that person, how do you do all these things, which we will get to see as we progress subsequent days. Another of your major duty is emotional support. Emotional support, because like I said, you spend more time with these patients. And because you spend more time with them, it allows you to build trust and rapport. It takes trust for you to be able to get the best out of someone. It takes for you to engage with a person. Just as I started on this platform when I was talking, it took most of you a level of trust to be able to engage, to say, oh, how can I just let go of my 80,000? Because at least 80,000 is the first installment. Some will say, well, let me just pay the 80,000 naira. Well, let me just see. Let me just pay the 80,000 naira if they go with it. I mean the new people anyway, because the old one already know that we are for real. We are for real. So it takes trust, like I was trying to say, before you can engage with anyone. So as a healthcare assistant, you have first-hand engagement and interaction with this patient. You spend more time with them. You help them with their activities, personal activities. You bond with them. You connect with them. You provide companionship with them. So you see that you are very important. In most cases, in all cases, HCAs are closer to the patients than the doctors. Doctors just come around for their routine checks and do whatever they need to do, and off they go. But you check. If there's any challenge, it is you they'll first reach out to. You monitor them. If they have bruises while maybe bathing them, or they have anything that is out of the ordinary, you are the first that would see it firsthand before you report to appropriate quarters. So you are closer to the patients, and as such, you build connection and you provide companionship. Some of these patients, they experience feelings of loneliness or anxiety. Different things happen to people in the hospital. If you go to the hospital or you visit a care home, then you will understand you will know that you will know that the world is very deep. Let me just say it like that. You see people pass through a whole lot. So these people, some are having depression, some are depressed already, some are having issues, emotional issues. They are feeling lonely. Some are anxious. So these people, with the techniques, with the skills that you are going to learn, with the communication skills, with everything you learn on this training, it will help you to function well, because you will know what to do at any point in time when you sense those things. Do not forget also, we have mental health awareness on this platform, which you get to see and firsthand understand the signs of depression when you see them. That's the advantage you have over others that are just maybe an ordinary healthcare assistant that don't have that added certification. With that mental health awareness, you can check, you can diagnose at any point. When you see those small signs of depression, you know exactly what to, you can read them, you can read the handwriting on the wall before it becomes suicide or it becomes extra or worse. So that is one of the advantages that you have, those that have actually trusted us to take this training. So supporting healthcare too is very important. You support the healthcare team. You support the healthcare team. You work hand in hand with all the members of the team. You work with the doctors, you work with the nurses, you work with the friends, you work with everybody just in the team. You are more or less in the center. Because you take on routine tasks, maybe you do the routine tasks, those normal activities of daily living, moving around, maybe documentation, and so on and so forth. Now, it now gives the nurses and the doctors time to focus on more complex medical duties, the more complex ones that they have to do, maybe the surgeries, maybe the other procedures that they have to do. You are doing this other routine task. It helps them to be focused on the more complex duties. So you see that you play a supportive role. You support everybody that is intertwined in the healthcare team. Now, you also, not only that, you also serve as a communication link. Take note of that. That is one major thing, role of a healthcare assistant, a communication link. People communicate. It's just like in a home, a father, a mother, and children, you know. Most children, except the few some that are close to their fathers, you understand, especially female children, but you find out that like while we were growing up, while I was growing up, I used to pass through, okay, someone is asking if we are going to get the slide on the course. Very well, very well. Someone is saying volume, please. Please, can everyone hear me? Someone is saying volume, please. Am I audible enough?
Yes, very you well.
I hear you very well.
Okay, because I've seen volume, please. Pardon?
The volume is good.
Okay, all right, thank you, because I'm reading the chat box. I need to carry everybody along. That's what I like to do. Thank you. So, like I was saying, like when I was growing up, you know, I used to have a father that is very firm, you know, a military officer. Like those that have taken my training, they know I like to talk about my father sometimes, because that's when I first and foremost I got to really have the life and practical experience of the impact that a caregiver can have in a person's condition. That's why I learned firsthand from that. That's why I can say it, excuse me, anytime. So when we were growing up, like when we needed anything, you know, you would first and foremost go through the link. You won't just go to your father and say, Daddy, please, I need this, I need this. No, we go through the link. And of course, we know who is the link. You will have to first go to your mother and then discuss with your mother and try to whine her a little, you know, let her understand the need, why you need that thing. And mommy, please, can I have this? Can you just kindly help me talk to daddy for us to get this? So mother is always the link in between in most homes, though not all, because I have some that the reverse is the case. So before we can actually get what we want, we pass through the link. So that's how the hospital setting is, or in the care home setting is. You interface with the patients. So you are in the middle. When you see these things firsthand from the patients, you interact with the doctors and the nurses that are on the other side. That is what you do. So you serve as a communication link between the patients and the healthcare team, ensuring that the patient's needs and concerns are clearly conveyed. That's your major duty, because the patient will bond with you easily, will connect with you more than he or she. You find out that some of them may even have issues that are pressing them. Maybe they are feeling uncomfortable somehow, or they are having one or two challenges there in the hospital setting. You find out that when the nurse comes around, they wouldn't be able to say, they won't want to say exactly how they feel. Why? Because, you know, they have not bonded. So they just, and some of these challenges they have sometimes could be embarrassing. You know, illness, it could be embarrassing. I remember one time when I had to deal with a lady that had urinary issues, you know, and she sometimes, you know, urine just escapes from her like that. And she, you know, that's such a situation to her was embarrassing. To her was embarrassing. She could not say it. She could not tell. She couldn't say it because she felt that it was embarrassing. So even when the nurse comes around, she's not able to explain to the nurse what's happening to her. She's not able to explain how she's feeling. But she was very free to explain it with the HCA that was attached to her. She was very free because that one will sit down with her. How are you feeling? You know, we'll massage her feet, we'll talk to her, we'll smile. you know, we'll find out about her grandchildren, we'll remind her, give her memories of things she really loves. And you see, she'll swing into the mood, she'll loosen up, and she'll be able to release, she'll be able to confide or maybe discuss with the HCA. So you see what I'm trying to say? As a healthcare assistant, you play a very serious role. So you ensure that the concerns of the patient is properly conveyed to appropriate quarters. That is to the nurses and to the doctor. So that's a great duty, a very great one. And how best will you be able to achieve this is for you to ensure that you bond with your patients. Ensure that you bond with your patient, very important. You connect with your patient, and you cannot connect by being rude. You cannot connect by showing that you do not feel what the patient is actually going through. You cannot connect if you don't bring out that empathetic part of you. You cannot connect if you are not human in your attitude, or if you don't have an amiable disposition. You cannot. It's just like a school, for instance. Pardon me, I like to talk a whole lot because I was first and foremost a teacher. So many years ago, I was a teacher. So I'm trying to see how that part of me will go, but it's not just going. I like to teach. So it's just like in a school setting. Children are always scared. They won't, if they have a teacher that is hostile, a teacher that does not even smile, a teacher that is not friendly, a child would prefer to go and tell a total stranger what he or she wants or is feeling or is passing through than telling the teacher. But if you have a teacher, for some of us that have been fortunate to have teachers that are understanding, that always put up smiles, they're always friendly, you know, it's very easy. Even if it is in the midnight, you can walk up to that teacher with all amount of expectation and explain whatever your challenge is, because only the disposition of the teacher gives you a conducive environment for you to reach out when you have challenges. That is how a certified healthcare assistant should be with the patient. So what else? We want to look at another one, which is promoting patients' independence. Promoting patients' independence. Oh, sorry. Please excuse me. Someone is trying to drop a message. Okay. I like to carry everybody along. I understand that there are a couple of network challenges today, but I pray that it is resolved. If not, we'll eventually have to send the slide, like I said, whether there's network issue or not, you'll get the slide. So anybody that is not here should be rest assured that we'll carry you along. We've got your back in case network is not friendly. So we're talking about promoting patients' independence. Please, are we together? Can everybody hear me?
Yes, we are with you.
Yes, we're with you.
Okay. Okay, please, if I ask if we are together, please, I crave your indulgence for those people that are not at work, because I used to have some that will still be at work that will not want to talk, maybe because of their work environment. But those that can hear me, please kindly do me a favor. When I ask, I'll need to have response, because you are the reason I am here. So if you are not hearing me, then why am I here after all? So please, let's take that. Because sometimes too, over the years, I have people that will say, oh, you know, this is our adult learning. I know how it is. Me too, I was involved in these things at a point. Some maybe mothers in the kitchen struggling to cook, and they just keep their phone. Oh, what are they saying? Okay, I'm hearing, and they are turning rice on the fire. Or they are, so when you say, can you hear me? Oh, yes, you can hear you.
Yes, I'm hearing you.
They are doing what they are doing. So please, since I cannot see you, you may be in the kitchen cooking, or you may be, you know, trying to serve or dinner or something, but please just lend me one ear, because I will need to get response from you if you are together. Thank you so much. Let's go ahead. Promoting patients' independence. This is something that we need to know. When we get to the module itself, we are going to dissect it. Like I said, today is the introduction. So we are just on the peripheral stage. We are just on the peripheral stage at this point. But when we get into it, you would see this particular aspect, promoting patients' independence, is very important. Whether you are a caregiver in the sense that whether you are a professional caregiver or you are not a professional one, because a whole lot of us, we render caregiving services to our husbands, to our children, to our family members, to our loved ones, to our neighbors. We do these things, but what we just don't understand, the only difference is that we are not paid for doing that. We are not paid. Nobody pays us for doing that. But I believe that most of us here, we have been doing all these duties by extension without even getting certified. Maybe the only difference is just the certification. So promoting patient independence is very important. As a healthcare assistant, you need to assist your patients in gaining skills to manage their own care. Independence is very important. It is important that everybody is able to do things for themselves, at least to a large extent. There is nothing that kills a person. There is nothing that makes a person get into depression like a person that was living an active life all of a sudden is just allowed to, or is just relegated. Let me use that word. There's nothing that kills a person fast like that. That's why you find out that people that retire, sometimes in the side where I am, you hear someone retire before you know, oh, the person is having this or the person is having that. Why? Because the person may return to live a certain, maybe that's life of maybe moving, going here, doing this, attending to one or two things, you are just relegated to the background. That's how it is. Illness can keep you where you don't expect. Dementia can keep you where you don't, not you, sorry, forgive me if I say you, I mean, it's general, nobody here is having all those things. You know, so it can make someone feel, I don't need to use this word, but if there's anything close to being useless, I'm not supposed to use useless, but close to being not actually enjoying yourself, is when someone's independence is taken away from that person. So as a healthcare assistant, there's one thing I want us to understand, that you are doing this ADLS, activities of daily living, doesn't mean that you should take away the independence from the person. As much as possible, encourage your patients to do things for themselves. Only assist them. That is where you come in. Only assist them. If it is someone that can maybe wear his shirt, as we get to activities of daily living, I'll explain this, but I just like to talk about it. Allow the person, don't say, this person is having stroke. Oh, this person cannot even do. So you want to choose the shirt, you want to wear the shirt, you want to lift the person up, you want to do everything. No, that means you have taken away the independence from that person, which is not so good. But to a large extent, assist your patients. If the person can still manage to clip the buttons of the shirt, or the person can still manage to wear, let the person to an extent do some of the duties for himself. Though we have different levels of assistance. We have, when we get there, we'll talk about it. We have different levels of assistance. But as much as possible, do not take for the fact that somebody is vulnerable or the person is ill. You just take it that the person is not able to do some things for himself or herself. No, that's wrong. If you do that, it means you'll be the one doing everything. There are people that can actually eat. It's just that they are slow in eating. For example, maybe we talk about feeding. So if they can eat and they are slow in eating, all you need to do is to guide them. If they can pick up their spoon, if it's something they need to eat with the spoon, they can pick up their spoon and put in their mouth, just ensure that they do it for themselves. If they cannot, you can just help them to pick up the spoon, put it in their hands, and they do the rest. It is important, very important. So we shouldn't take away that from them. As much as possible, assist them in gaining those skills that they need to foster their independence and build their self-esteem, so that you don't kill their self-esteem. Very important for us to note. Sometimes we may be tempted. Sometimes we may be tempted. Now, let me give you an illustration at this point. Do an emotional one. I don't want to get emotional, but I'm just trying hard not to. Like, I like talking about my father. Now, when my father was, people that have attended my trainings may be conversant with this story. You know, when my father was down, I mean, my father is a man that I have known all my life, that I've never seen his weakness. I used to wonder, has this man ever had any dull? He's always on top of his game as a military officer, you know, always talking to commanding people, passing out instructions, doing this and doing this and doing that, you know, he was always on top of his game. So, but all of a through my growing up years, I've never seen my daddy even one day say, I have headache, or see him say, oh, going to the hospital. No, I grew up with that kind of father that was authoritative. When you hear him coming, your nonsense stops immediately. When you just hear the car coming, whatever you are doing, you locate your book, you look for your anywhere, even if you are not reading, you just carry it and stay, hold it. That's the only way you can be free, or else you know what is waiting for you. So all through, I have seen that kind of life. But when my daddy actually took ill, serious illness, he was unable, he had prostate cancer, and he was unable to do those things. It was as if we knew that, Kai, if we don't handle him properly, that he may not last for long, because I thank God this thing has not happened, but it has just decided to happen now. Please, are we together?
Yes,
Hello?
ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, I think
Yes,
there is
ma'am.
network. Please bear with me.
Network issue.
Whenever there is network fluctuation, yes, once there's network fluctuation, my screen travels, it goes off. So please just do well to bear with me a little. Let
All
me
right,
share
ma'am.
the screen back.
Okay.
Once it happens like this, the screen disappears. I'm trying to share it back. So, okay, please, can you see my screen now? Are we together?
Yes, ma'am.
Yes, ma'am, we can see.
Yes.
Yes, ma'am.
Okay,
Yes,
sorry,
ma'am.
let
Can
me
we
move
take a
fast. We'll
break
soon
because
take
it's
our
almost
break.
the break time so that you can sort out the things. It's almost
Pardon?
break time. Can we take break so
The
that you
break
can sort out
Yeah,
the
itself.
yeah.
things because it's almost time so that it will give you time to sort out.
Okay, we'll soon take our break. Let me just be done with these two, yeah, thank you. So finally, like I was saying, I said that I got to see my father like that. So we were actually helping him do a whole lot of things. He wants to wear his clothes, we want to help him, his shoe, want to help him. And we saw that it was not good. He wasn't saying anything until one day he told us, is it because I'm like this? Is it that I've just turned all of a sudden into a vegetable that you feel like, do you children feel I can't do anything for myself again? That was when I knew. I read the handwriting on the wall and knew that that he was feeling, there's how he was feeling. It was affecting his self-esteem because he's a man that was in charge and now he has most of these things being done for him. So that's why I was trying to tell you that it is important for us to know how to handle these people so they can live longer. People that we don't take away their independence from them. Okay, we also have education and literacy. It is important that patients understand what is expected of them. And who best can do this is the healthcare assistants. It's your duty to educate patients about their health conditions, about their medications, about their treatment plans, how they can live healthy lives that will prevent further complications of the issues that they have. It is your duty, very, very important. Okay, and also enhancing healthcare accessibility. You as the CHCA there, it is important that you help, the healthcare team serve more patients. You are there for a reason. You help them to access more patients, to be able to serve more people, especially in settings. Some settings can have very high demand, such as hospitals, influx of people with different illnesses, with different ailments, or nursing homes. You are there to help, to assist in every way possible, to ensure that the patients actually have correct medical supplies that they need. They're actually taken care of. So this is practically most of your duties, as well as how important you are in a particular setting as a certified healthcare assistant. Your role is very, very critical. So on that note, please, I would like us to take a short break. Right now is 6:30. So we would convene. Let's take 15 minutes break and we would be back here 6:45. I guess that should be fine. Just 15 minutes break. Please, are we together? Can everybody hear what I just said?
Yes.
Yes,
Yes,
ma.
yes.
Yes, ma.
Yes,
We
ma.
can
So
hear.
let's stretch so
Ma,
that we
we
don't
can hear
have.
you.
Thank you.
Oh,
Thank you,
all
ma.
right. So let's stand up, drink
Thank you,
water, shake our legs, and then we'll be back. Thank you so much.
Okay.
Okay, God bless.
Thank you, ma'am. Thank you so much.
Yes, ma'am.
back. Our time is up.
Yes, we are back. I'm back.
Okay, our time is up. Please, let's get down so we'll be done. Okay, the other people are still trying to tidy up. Oh, all right. So while we
are back. I'm here, ma. We are back.
Okay. All right. Thank you. Thank you. So I think they will join us because we don't have much time. So we want to continue from where we stopped. Let me put the slides in slideshow. Good. Fine. So we were talking about our last slide was promoting patients' independence and a whole lot. So now we are going to look at basic healthcare skills. Basic healthcare skills. Now, as a CACA, a healthcare assistant, there are skills that you need to learn. There are skills that you need to have in or at your fingertips that will help you to function effectively in this field of caregiving. This is very, very important for us. In any career that you find yourself, like I was saying before we started, the training you are going to have on this platform is going to help you not only when you eventually become a certified a healthcare assistant, it will also help you in your relationship with people. It will help you in any place you find yourself. That's the beauty of this training, because when we delve deeper, you will understand what I meant by saying that this training is apt. Now, there are skills that you have to learn. There are things that would help you, because we would love to have good news, especially those of you that may wish to relocate, may wish to go out, get jobs, to work as caregivers, or in any way, even in your relationship with your parents, your family, and your neighbors, want to hear good results, reports back to us.
Please let us
these are some of
our mic. Some people's zone is on, is disturbing.
Let's see if I had already said that, because when the mics are on, it's not going to help us. It's just not going to do us justice. That's the truth. We will stay here. So please, let's try to do the needful so that we don't overstay here. You have to rest after having a hectic day's job. So personal skills like bathing, like grooming, like dressing, these are things we talked about, activities of daily living. So you need to not only knowing, like we stated earlier, not only knowing the things that you need to do, your role as a certified healthcare assistant, is for you knowing how to do it in such a way that you will stand out, knowing how to do it in such a way that it will be beneficial, that it will help your patients to recuperate faster, that it will have a positive effect on your patients and all the people that you come across. Is very important. So these are some skills that we are just going to be, like I said, today is the introductory part. We are just looking at it on the surface. As we go deeply into it, we have activities of daily living as one module on its own. So when we get there, we'll now talk about all this. So, Beth, these are holistically the skills that we need. The personal care skills, taking care of your patients personally. Bathing, grooming, dressing, toileting. You may need to take care of the toileting aspect of it. Trimming hair, nails, hair care, dental hygiene, maybe taking care of dentures, taking care of the teeth, and so on and so forth. So you need to have these skills. When we get to the ADLS proper, you need to learn these skills that will help you to function effectively in this area. We also have the mobility assistance too. You help your patients to move around, use assistive devices, that we'll get to see, like walkers, like canes, equipments that can help their mobility, can assist them in their movements. And you also would learn the skills that are necessary so that you don't harm yourself, skills that will help you protect yourself as well as your patients too. There are certain ways that we do some of these things that may have a long-term effect on us. You see, there are some professions that people go into that they end up with severe back pain, severe waist pains, you know, different things. Why? Because maybe they didn't go out, they didn't align with the proper techniques to go about that. Maybe like helping your client transfers, doing transfers. How do you do it to avoid pressure on your waist or on your knee? We are going to look at all these things. Also, we have the basic first aid too. Thank God, the CPR and first aid. So when we get to that module, you are going to see that it is very, very important for a CHCA to have good knowledge of CPR, to have good knowledge of first aid. That is a plus to you. When you have the mental health awareness certification, you also have a good knowledge of first aid. I don't know what else you may need. You are already an ace. I don't know whether I don't know how to put it, but you already have an edge over others. Now, your communication skills also, you need the right communication skills. This is very important. Communication cannot be overemphasized. Communication is important. Even as a worker in your workplace, how do you communicate with your colleagues? How do you communicate? Do you understand? Do you show your empathetic side, or does the world revolve around you? Because we have some people that actually act as if the world revolves around them. Everything is about me, it's about it's about, you know. So these things don't work. So communication skill is very, very important in all facets of our lives, in our social life, in our family life. How do you communicate with your family? If you are single, how do you communicate with your friends? If you are married, how do you communicate with your children, your husband? Communication is important because it can spoil a relationship and it can also mold it. So aside that other relationship, now, even with your patients, the way you communicate with your patients can make you get the best out of them. Very important. If you are harsh, it's just like us women will relate more to this. If you have a house help that helps you in the house, the way you communicate with her, the way you treat her will go a long way in you telling whether your children will be safe or not. That is just how it works. So even in a hospital setting with your patients, how do you communicate with them? It is the way you communicate with them that will make them to open up to you when they have challenges, that will make you to spot when they are going into depression, that will make you to know when they are abused. Maybe they are abused at home or abused anywhere. You know, it will also help you take a step into their lives. The way you communicate will either build trust or will widen the gap between you and your patient. So these are things that we would see when we get to communication skills. You would see that it is one of the major skills of a CHCA, communication. In all aspects, there is no part of this training that you touch that communication will not somehow find its way in it, because it is a key skill that a CHCA, a healthcare assistant, has to have in order to function effectively. So we have to move. Good. Now, we want to look at infection and infection safety. Very important, like I was trying to say. As a caregiver or as a healthcare assistant, you know the duty of your work. Up until I actually got very into the health sector, I used to wonder, I used to say, how do nurses even cope? If I see a nurse, I'll say, because up until I actually really got involved, if I go to a hospital and just the way the hospital smells, that's the way, you know, the drugs, the sterilization, the way it smells, it just puts me off. And then when I was growing up, I used to think, how do nurses cope in this type of place? How do they cope seeing blood? How do they cope, you know, seeing a whole lot of things? How do they cope? I used to think that when in my much younger years, but ironically, I never knew that I would actually end up in the health sector. I never knew, because I was really wondering how they cope. So what is this bringing me to? As a certified healthcare assistant, you have to, another very important thing you need to know is this infection control, health and safety. This topic is very important because as you are working, you should not only look out for the safety of your patients, of the good health of your patients, no, but you should as well consider yourself. That is what I'm driving at. Consider yourself, that you'll be exposed to certain hazards on the job. hazards on the job. You'll be exposed to fluid, your patient's fluid, you'll be exposed to maybe blood, you'll be exposed to a whole lot of things that can easily cause infection. So infection control simply refers to the measures and practices that are designed to prevent the spread of infections within the healthcare setting. That's just all. How do you control this infection? How do you prevent it from happening? To understand how infections spread from one person to another, like I already stated before, you find out that, like mothers, you can relate to this. If one person has a flu, if you are a mother, you have children, or even if you don't have children yet, in a confined setting, like in a family, if one child has a flu, you will do yourself well to treat all your children. Please, can we mute our mics, please? Someone is actually speaking into what we are saying. Thank you. So as I was saying, if you are a mother, you quickly say, oh, Paul is having catarrh or is having flu. Oh, quickly, you want to treat Paul. Because, you know, if you don't treat Paul, before you know, Mary, Agnes, and John will all be down. Why? Because infection spreads fast, especially in a confined setting or in a confined space. That is what we need to understand. So let's look at the chain of infection. First, we want to start with these infectious agents or pathogens. You can call them pathogens. What actually causes this infection? Bacteria, virus, fungi, parasites. These are things that causes infection. Now, this infection chain is divided into 6, like it's broken into 6 key links in the chain. Like you can see 1, 2, 3, 4, 5, 6. Now, when we are going to look at it from pathogens. What actually causes? Pathogens are the things that actually causes this infection, germs that causes the infection, like bacteria, like viruses, like fungi, like parasites. They cause infection. Now, like those that cause bacteria that causes strep throats. When you have strep throats, you have the sore throat. Some people call it sore throats. Yeah, you have that. It's caused by bacteria. Viruses could get into you. It results in you having flu, or like the COVID-19 is as a result of virus. It's a virus that caused that. We also have fungi pathogens too. Fungi infection. We are looking at the infectious agents or the pathogens now. We also have the fungi that can cause maybe athlete's foot. Some people, you look at their foot, you see some very terrible things in between their toes. It's caused by fungi. So these are different pathogens that could actually cause infection. And how can you prevent that? When I talk about it, we are going to be looking at them one after the other. How can you prevent them? So in this chain now, you see the pathogen, you see the reservoir. Now we have the reservoir, we have the portal of exits, we have the mode of transmission, the portal of entry, and the host, the susceptible host. Now, chain of infection, this is the pathogens. Like you can see there, look at the germs. I think this should be also familiar with people that did the CNA because it's interwoven. Just 1 or 2 modules or 3 are interwoven with the CNA. So you see, like you can see there, pathogens are microorganisms that cause diseases. Like you can see bacteria form. Sometimes you get to think that your hand is clean, just like you've seen what is happening there. You say, oh, my hand is clean. I have a daughter that when you say, go and wash your hands, you say, oh, mommy, my hands are clean. See, she'll open her hands and show me that her hands are clean, because as a child, she just looks at it and thinks that it's clean. So, but you can see that hand that you can see from wherever you are seated that is clean. You can see the germs. You can see those tiny things on it. So, hence, it is important that we wash our hands. So pathogens are simply, like we said, good hygiene practices like hand washing can help reduce the number of germs that can spread. Hand washing. Now we are going to, like I said, this training, we are going to have the practicals of it. So we are going to see all the practical aspects. BCC UK is very good at doing that. They form the curriculum in such a way that it embraces the practical aspects. And we will surely do justice to that when it gets to that time. Hand washing is very important as a CACA. In fact, it should not leave you. Wash your hands. Never get tired, because just the easiest way for infections to spread is through the palm, through the hands, like you can see there. That's the fastest way, the easiest way for infections to spread. So by you taking time to actually carry out good hygiene, washing your hands carefully and not all the time, using hand sanitizers, you'd understand that just understand that it's something that you cannot do without, that cannot just leave you in this business of caregiving. You need to wash your hands to be able to stop germs from spreading. Okay. Now we also have the reservoirs. That's the next one. Remember, there are 6. There are 6 key links. The first is the infectious agents, which is the pathogens. And then the next one is the reservoirs, like you can see here, reservoirs, where something is stored, reservoirs. Now, in humans, there are 2 forms of reservoirs. In humans, we have the symptomatic infection and the asymptomatic carriers. There is a difference. What is the difference? The symptomatic infections are actually those infections that will show you the symptoms that you would see. They occur when an individual shows clear signs and symptoms of an illness that is caused by an infectious agent, such as bacteria, virus, or fungi. That one is symptomatic. You see the symptoms. They are visible, such as maybe fever. You know, someone is practically hot and having fever is visible, is symptomatic. You can see maybe cough. The person coughs persistently. You know, something is wrong somewhere. You know, you can also see fatigue, maybe a person having pains or fatigue, or maybe the person experiencing some gastrointestinal issues with the intestine. Depending on the type of infection. These are things that we need to know the difference. Because when you see, it's easier for you to treat, it's easier for you to act when you see symptomatic infections, because they give you the sign. You know that something is wrong, so you can easily act. For instance, a person with influenza exhibits symptoms like fever, like chills and body aches, making it clear that the person is infected. Making it clear that the person is infected when you see those symptoms. But we have the asymptomatic carriers. They are individuals who harbor an infectious agent, but they do not exhibit any noticeable symptoms. There are a whole lot of people, they have infections. If they're infected by maybe virus, bacteria, somehow they are infected. They have some infections in them, but because they are having the asymptomatic, they are the asymptomatic carriers, people don't even get to know what is actually wrong with them because it's not visible. You don't see it. So it's important we know these things and we know the signs. Now, the ones that are asymptomatic, that you don't get to see the symptoms, these individuals feel perfectly healthy and may not even be aware that they are infected. But despite having no symptoms, asymptomatic carriers can still spread these infections to others unknowingly. They don't have the symptoms, so they don't know whether they are spreading it. They don't know whether anybody is contacting it, because they are not symptomatic. It's not visible. To them, they are feeling very okay and they have no issues. Then how can they spread anything to anybody? That is it. That is where the issue sometimes lies. Now, and these asymptomatic carriers are typically identified through screening or testing. These people that are actually asymptomatic is through screening them, doing detailed analysis on them, screening them or testing them, rather than seeking medical care due to symptoms. So it is important that even as you are treating patients, you are working with patients, it's important for you to note these differences, because if you are only on one side looking out for the symptomatic infections, even in your home, in your environment, or anywhere, you keep moving without knowing that there are many infections. There are some people that have this as some asymptomatic carrier behavior that will not really show you any symptom of what is actually happening to them. For example, a person infected with COVID-19 may not show any symptoms, especially initially, may not show you any symptoms. You understand? But can still transmit that COVID-19 to others. That is why at that time that it was in the heat, the peak period of that, people were advised to use their nose mask, wash their hands, do all those things. Sometimes ignorance made so many people to actually have that illness because they would not adhere to simple protocols, safety protocols. Use your nose mask, no, they wouldn't use it. Use your face mask, no. Wash your hands, no. In establishments, in organizations, I remember one of the places I went for screening to check. They were so, they had this lackadaisical attitude. They were not concerned about the instruction. They will not wash their hands. In fact, some of them were even caught at different times saying, this thing is just scam. No, there's nothing like COVID-19. They are just deceiving. They were having one kind of mindset that I cannot even understand. As a result of that, so many of them went down with that illness because, like we are talking about chain of infection, it kept spreading and spreading and spreading and extending to others. Before they could actually know what was happening, it was too late. So these are two different types of reservoirs, human reservoirs in the chain of infection. Okay, after that, we want to look at the portal of exit. That's number 3. The portal of exit. What do we mean by this portal of exit? How this infectious agent leaves the reservoir. Remember, we have talked about the reservoir where it is stored. Now, it can be stored in the body. You would not know, no symptoms. It can still be stored in the body. You may know, depending on whether it's symptomatic or asymptomatic, which of them. Now, this portal of exit refers to any routes that the pathogens can leave the reservoir. How do they go out? Maybe you've been having this flu for a long time. It has to have a portal of exit. It's just then it has to come out either when you sneeze, like you can see that man doing, or when you cough without following normal procedures like we would learn. You don't cough into your hand when you cough. Rather, you cough into your elbow. You curve your elbow and form a sign of greater than. For those of us that still remember our mathematics, when you form a sign of greater than, you have your elbow curved. You can cough into it instead of coughing into your palm. These are some of the things we are going to learn as we progress so that we don't spread infection. Imagine a healthcare worker, maybe like a healthcare assistant, coughing into your hand, your palm, and you use that palm to attend to your patients, you use that palm to move around. You can imagine the number of vulnerable people that will be infected through that, your one single careless action. So that is why it is important that we have to be on top of our game. Now, there are different ways, like you can see vomiting, diarrhea, alimentary. You can see the sexual contact. I don't intend to take you I don't intend us to delve too deep into it, just on the surface. Now, secretions from coughing too, sneezing, open wounds. These are portals of exit because when your wound is open, you know what that means. It brings out, and you have this infection. It's very easy for someone to get in contact with it. So. Fine. All right. So we have, let's see, where have we gone to? Please don't go anywhere. Okay. So this is number 3. Now, the other ones that we want to look at, we have the number 4, which is, we've talked about the portal of exit. And then the number 4 is the portal of exit. That's number 3. Then number 4 is the mode of transmission, like we can see here. Pathogen, the reservoir, portal of exit, the mode of transmission. Now let's get back to it and talk about the mode of transmission. Very important. Now, how? We've talked about a portal of exit. How can this particular infection that we have, how can it be transmitted? That is mode of transmission. Through direct contact, where you touch someone, direct contact. Touching an infected person or their fluids directly. You are dealing with a patient that maybe has HIV, for instance, or maybe has one challenge or the other, and you are touching, has one infection or the other, and you are touching it, directly contacting without washing your hands, without taking all those precautionary measures, of course, what do you expect? You are bound to get it. So direct contact is one way that you can get the infection. And then indirect contact, too, touching surfaces or objects contaminated with these germs. A person that has, maybe that doesn't wash his hands properly after carrying out a procedure that has an infection, without washing their hands properly, goes and handles the doorknob. For instance, let's just look at a clear example. Maybe the doorknob wants to open the door, uses that same hand after sneezing into the hand with germs, now opens the door and moves in, continues with his normal routine. Another person comes and uses his hand and opens that knob. You can imagine the extent to which the germs would spread in the air. Then we have the airborne transmission too, breathing in droplets that are in the air. Airborne, like the COVID-19 we talked about, is in the air. So if you don't cover it, someone sneezes into the air and at your proximity, you get infected. Before you know, you begin to experience the symptoms. We don't wish for those, because what really happened during the heat of that COVID-19 era is something we don't even need to remember. So how can you guard against these things? How can you guard against it? Maintain distance, practice good hygiene, disinfect surfaces and break the link. Don't worry, when we get to infection control properly, you will see it firsthand. Like all this transmission, all these ones I'm talking about, we are going to look at them. So surfaces, disinfect surfaces, like women, us that like to cook. Don't just chop your meat, and you leave the surface. You just take water, take rag, just clean it and off you go. You don't know which of your children will come and touch it. You don't know will come and touch that surface that is not disinfected. And from there, maybe cleans his nose or allows it to enter through the portal of entry, maybe through the nose or through the eyes or something. Before you know, you wouldn't even understand how that child is taking ill all of a sudden. So these are things that we should guard against, not only working as patients, even for our own personal lives also, to help break this chain of infection, to help break it. There are things we need to do. We also have the portal of entry, which is the fifth one, respiratory tract, breathing in germs. When you breathe in germs through cuts or abrasions in the skin, you have a cut, you have abrasion on your skin, through the mucous membranes too, such as those, the eyes, your eyes open, your nose, your mouth. These are mucous membranes where things can easily come in. So how can you help that? You have to try to keep wounds clean, and you use mask to block germs from entering these portals. Very important. And then the last but not the least is the susceptible hosts, which are the people that are prone to having these challenges. Now let's move there. Let's get back there. Like you can see from the portal of exit, mode of transmission, portal of entry, the mouth, the nose, the eyes, the cuts in the skin, the susceptible hosts, the elderly people, the infants, the very people that you are working with are the susceptible hosts because they are vulnerable. Elderly people that are ill, have one illness or the other, weakened immune system, or their immune system is compromised. And of course, anyone. It doesn't really, why that anyone comes into the picture is it doesn't have to be the people that you can see the symptoms. Okay, you know you work with vulnerable people, and so of course, you should be careful with those vulnerable people only. No, not at all. Anywhere you find yourself with anyone in the workplace, keep your distance. Keep your distance. Remember that time we're preaching distancing when that COVID-19, during the COVID-19 era, distancing. From where I come from, we do a lot of huggings. That's if you come from my part of the world, we hug people a lot. It's a sign of love. Maybe someone you've not seen in a long time, or you just seen your mother or a close friend. You show that love by maybe giving a hug. But during that time, so many things came in. People were confused. They say, don't hug, don't touch, don't do this, don't do that. You know, but when we do the little things that are important, washing our hands, maintaining distance, sneezing into our elbow, and using our PPE that we are going to see, it will go a long way in helping us to guard against the situation. Okay, now, because I have talked so much, I would like to pause at this point to ask. I have been able to say some of these things. So I know that there are medical practitioners on this platform. I know that we have some that I have lectured, that I have taught, in trainings, formal trainings, we have them on this platform. So it's not in my nature, like it's going to stop from today. I don't know why I'm really talking, because I'm guarding against network issues, so that will be done before the heat of the network challenge will actually affect us, as God has been so faithful since we started. So at this point, please, I need to ask, please, I need contributions as to ways that people could get infections. Now, what are some of those ways? What are some of those things we do, you know, that could actually spread infection from what I have said, maybe added to what I have already said? Because the floor is too quiet. I don't like very, very quiet sessions of me doing the talking. So are we together, please? Who is ready to help us? Madam Ogweze, you are here, and it's nice to have you. So we'd like to learn from your expertise.
Good evening.
As a specialist.
Good
Yes,
evening.
good evening, madam. Help us. I know you are always active in trainings, and you are there, live and direct, in the heart of all this talk. So share with us some other scenarios where people can get infection in the workplace or at home.
Yeah, good evening. Oh,
Good evening.
Good evening.
good evening, everyone.
Good evening, madam.
Good evening.
You know,
Sorry, madam. Please, can we mute our mics? Okay, for the last time, please, let's mute our mics so we can hear Madam Ogweze, please. Let's just simply do what we have to do so we will not overstay here. Thank you, ma'am. Go ahead, madam. Hello, Madam Ogweze, please go ahead. I was just asking everyone to mute so we can hear you better.
We are not hearing you. Hello?
Hello, can you hear
Madam,
me now?
yes,
We are not
yes, go ahead.
hearing you.
We
Can
lost
you hear
you.
me now?
Yes, we
We are
can. I
hearing
can
you.
hear you.
But you can hear me now.
Yes,
Yes.
yes.
There are in which you can get infected from the patient you are managing. Do you understand? The patient you are managing, if you don't take care, can infect you. I could remember during COVID, almost, in fact, all of us in my hospital, we are all infected, despite all what we tried. So as a healthcare professional, because I know for us to start this journey, we have started, and I'm positive, you know, to combine both. But you can be infected from the person you are taking care of, like the patient. If you are not well protected, if you don't manage yourself well, you can get infected by the patient. The patient can infect you. It can be through sometimes nurses can be attending to a patient and they will mistakenly pierce their skin from the syringe they are using for the patient.
That's correct, yeah.
Do you understand? And it's always bad when you already know the status of the patient that you are handling. You know, good. If the patient is negative, you won't be scared. But if the patient is positive, you will quickly be placed on antiretroviral, immediately PEP. Do you understand? For you not to be infected, even if the patient is infected and you take care of yourself, undergoing the drugs, the medication, you won't be infected. Yes, you won't be infected. I know there was a time I had issue with a patient. I went through the drug, and after the test, I was okay. Then, you know, we can be infected too through our children. That's what we don't know. There was a time there was an outbreak of chickenpox in my children's school. Lo and behold, I got it. So I got it.
Yes, that's your signature. You have to get it. It's your child.
Yeah. Yes, you can be infected. You are protecting yourself, but your child will come in from school. Your child will come in from school and infect you. Then let us not forget about, we can be infected sexually too.
That's correct. Yeah.
Yes, we can be infected sexually. You have to at least know the status of your partner. But notwithstanding, we don't know the movement. We don't know the movement of our partner, where they go to. But you may know the status, but you don't know their movement, because somebody can be negative today and be positive in 6 months' time.
That's right. Yeah.
Then another route of
you.
getting infection is through kissing too. Through kissing. I know that all of us are adults, there's something you will know.
Yeah, go
This
ahead.
one that is running now, this one that is running now that everybody is doing is the highest mode of infection. All these oral stuff they do. Yes, I know we are adults, so that's why I'm mentioning it. All this oral, they will tell you, somebody told me, I was educating somebody, she said, but blood is not involved. I asked the person, what is the meaning of sperm, spermatozoa?
What fluid?
You see, and you know, somebody, and
thank God.
So, and you know that the person you are dealing with can have bruises on the skin. And when you have bruises on the skin and the other partner have bruises in the mouth, that's the highest mode of transmission, because all they need is that bruises for the blood to go through. So there are so many ways you can be infected, so many ways, even through childbearing. If you are not managed well through childbearing, you can get infected from the hospital.
Yeah. Thank you so much, Madam Ogweze. Thank you. Thank you for sharing all that with us. I know that a good number of us know this, but some people really actually have phobia to talk, as in phobia in talking. So, but however it is, as we progress, we would have more people respond. So thank you, ma'am. And thank God that we as healthcare assistants, we wouldn't go about kissing our patients. It's important we know how. Thank you so much. How we get these things, because there's a very thin difference, a thin line between you getting infected and actually staying safe. For in terms of working, just as you have said, in terms of working, you definitely will know the status of your clients. And people really think that HIV, HIV is a death sentence. And thank God for the drugs available now. So even as a healthcare assistant, people that work in hospitals or work in the health sector, they are always advised to have routine checks, because there are things that could happen unconsciously. You don't mistakenly, maybe just in a chair, in a split second, something can happen that you are not conscious of. So if you actually do the routine checks, because these things, infection is one of the hazards of the profession, of the health profession. If you are anything you do in the health setting, infection is one of the hazards, because if you are not careful, if not properly handled, you are exposed to having infection. You are exposed to those hazards. It's just like people that teach, different professions. I don't even have to talk about that. Engineers, everybody, we all have hazards that are attached to our job. So as a healthcare practitioner, that's one of the things you really have to look out for, because you may not have that very big accident you are thinking. It could be just as minor as you losing guard of being careful with the things you really need to be careful about. So thank you, Madam Ogweze. I don't know if...
There's something I understand. Most of us that wear scrub. We can infect
PPE, correct. Yes.
We can infect our children. If you don't change at work and come back home, you can use the clothes you use in attending to patients, infect your children.
That's correct. Thank you so much, Madam Ogweze, for that. Like I had said, these things are things that we are going to learn. Thank God it's coming up early. We are going to learn. We are going to see PPE, personal protective equipment. We are going to see how to remove them, how to don and doff them, how to remove them in such a way that we don't spread, in such a way that the outer surface does not come in contact with your skin. Very important. So all these things is very easy. Like I said, once you are doing one or two things in the health sector, you are prone, very, very prone to having infection if you are not careful and doing the necessary things. So now let's quickly just look at Mr. Ahmed Musa Naziru. It's nice to have you. I don't know. I don't think I acknowledged you when we started. So I've just seen you now. You're welcome. Thank you for being with us, for taking time to be with us. Okay.
Thank you, ma'am, for having me.
So we want to look at how can we break this chain of infection? To prevent infections, it is essential that you break every link, anything that serves as a link that connects from one person. You just have to break it. Regular hand washing, using hand sanitizers, and maintaining cleanliness in your surroundings, in our surroundings, in the hospital surroundings, in your patient surroundings. This is very, very important. If you can just do that, very little things that you can do can go a long way in averting certain dangerous situations. Like I was saying earlier, when we talk about this hand washing, now that we are in the health sector, you know, we'll understand it better. Anyone that is not in the health sector, if you just maybe walk up to teachers that teach in the school and you emphasize the importance of washing hands, they may just do it the first day, the second day, and off they go. Or some people, that for what we actually do, it is important that we wash our hands. Hand washing cannot, the need for us to wash our hands, for I cannot even overemphasize it. We can't talk about it too much because it is important. It is important because hand washing, we according to Center for Disease Control, we have statistics have been carried out that germs from their hands is the greatest cause of infection. Any other thing can be maybe 70, 50, but the greatest, the highest percentage is from germs that come from the hand. When you sneeze, when you cough, because the hand, you do nearly everything with your hands. So at the end of the day, you interface, you use your hands. So you have to keep washing your hands, practice it, make it a routine. Use hand sanitizers, maintain cleanliness around your environment. It is important. Vaccinations too, stay up to date with vaccinations. How you can break this chain. Stay up to date with vaccinations to protect you against specific infections. There are vaccinations that they give you maybe quarterly. There are some you take once in a year. Just keep updated as to the vaccinations and do take them. I have a friend that she is a caregiver. Actually, she's working in, I think, Australia as a caregiver as I speak. You know, she was one person that she would never, up until she left, she traveled to Australia. When it's time for vaccinations, there's vaccination for this or vaccination for that, she's never there. She's never interested. She'll say, please, all these vaccination things, all these things doesn't just work. You know, they're just trying to deceive us and all that. She would never take any vaccination. But I thank God that she found herself in a place and in a profession where she cannot take she can't take those things for granted. She knows that she has to do it. So what am I saying? We should, because there are certain vaccinations that will protect us against the hazards that are attached to our jobs as healthcare practitioners. So we have to stay on top of the game. Vaccinations for ourselves, vaccinations for our patients, also very, very important. And understanding how infection spreads, like we took time to talk about what causes the infection, how does it enter the body, how does it exit, which is the vulnerable group, you know, that are prone to having this infection. Learning all these things will help us to stay safe. It will go a long way in helping us to stay safe. We also have the PPE that we talked about that Madam Gweze was trying to say. We have the PPE, the mask, the hand gloves, the gowns, you know, that we wear, the scrubs too, that we wear, personal protective equipment that we use in our duty, in the course of doing our duties. Also, environmental cleaning, disinfect surfaces like I talked about, where you chop your things, even in the house, you keep them clean, because we are not only talking about the patients here. Whenever we talk about infection control, it's both ways. Both ways, the patients, yourself. In fact, it's divided into three. So yourself, the patients, and the other team members. Very, very important. You have to ensure that you keep your environments clean, you disinfect surfaces, any place that you know surfaces, regular disinfection of surfaces, hand washing. I cannot even talk about that. Then also another practice that can help break the chain of infection. Sometimes you see that some people are actually quarantined. They're actually quarantined. They are kept separately, like when we had that COVID. Well, once anybody is spotted in a health facility, is spotted with or comes in and is discovered that the person actually has that particular issue, they isolate that person. Isolation, that person is kept for a period of time. You know, taking medications is kept until it is proved beyond reasonable that the person is tested and sure that he or she doesn't have that again before the person can be allowed to reach out to others. Why? Because if that person reaches out to others, it will spread like wildfire, especially airborne diseases spread very fast. So keeping sick individuals away from healthy ones can help us to prevent the spread of infection. Remember, we are talking about the things we can do to prevent it from spreading and also controlling it, checkmating it. These are some of those things that we are looking at. So I don't know if there is any other protective, personal protective equipment. It may not be in the hospital setting alone, even if it is outside. At this point, I've heard Madam Ugweze. I would like someone else to please tell us some other protective equipment. We've talked about the gloves, the mask, the gowns. What else? What are some other protective equipment? It may not be in the health sector. It may be maybe even in your place of work, in your different professions. What are those PPE equipments? Can someone help us? Mr. Ahmed, please, I know you work somewhere where you really need to use some equipment, some gadgets to protect yourself. So can you give us some other protective?
Yes,
Hello?
madam. Hello, good evening, everyone.
Good
Can you hear
evening,
me?
engineer. Yes, I can hear you. I guess we can. Please, can we hear
Yes,
Mr.
we can
Engineer
hear you.
Ahmed?
Yes.
We can hear you.
Okay.
Okay, please,
Yes.
the PPE mentioned earlier is almost everywhere, but in the environment where I work, as much as there are noise, so the one that is not mentioned is the earplug for noise. And then also we have safety boot that we normally wear for the foot as a footwear, foot protection also. That is not also, I've not had anybody mention that one through. So, but in a hazardous environment where we come in contact with chemicals and gaseous hazards, the protective equipment we have, substances, sorry. We have a breathing apparatus where we can be able, as it serves also as a personal protective equipment. So all these things, I think it wasn't mentioned. So these three are those things that are not mentioned in the health sector, but we normally use them here where I work. Thank you.
Thank you. Thank you, Engineer Ahmed. Thank you so much. I decided to ask you because I know you would have a couple of ones that are really out of the health sector. Thank you for that response. Okay, so that being said, we want to look at the last before we move. I assure you that 7:50 we'll be out of here. I know we need to rest because if it gets too quiet, it means that what I have been saying, some people could even maybe be relaxing and or eating or doing one thing or the other and waiting for the training.
Even sleeping.
Or even sleeping. Thank you. So I have done enough trainings to know how these things work. And I know adult schooling as well as I know how it was. So please don't worry, we'll soon be out of here. Okay, so we want to look at, like we said, summarily, when we understand the chain of infection, we can take proactive steps to protect ourselves, like I said, and others from illnesses. Every link in this chain is important. And by practicing good hygiene and being aware of how this infection spread, we can all contribute to a healthier community. We'll have a healthier community at the end of the day. So let's look at health and safety protocols. Health and safety protocols. In everywhere that we find ourselves, we have to try to stay safe. Hence this particular one, it is important. Health and safety protocols is just a set of guidelines and procedures that we need to protect our health and our safety of ourselves and our patients as well in a healthcare setting. That is just it. So what are the things? How can we actually ensure that we are safe or protect the health of these people? We want to look at certain things. Briefly, in the next 10 minutes, we should be good to go. We should be very, very, very good to go. Now, risk assessment. Risk assessment. In everywhere we find ourselves as CHCAs, in healthcare settings, we have to try as much as possible to identify the potential hazards that we may likely face. Like we are having this training, we are going to look at in a healthcare setting, what are as a CHCA, what are those hazards that you can visualize in a healthcare setting? What are some of those things that can happen that could be hazardous, that is not safe for you and is not safe for your patients? This is time that we will talk, because safety cuts across all facets of life, not only in the health sector. So what are some of those things that we can do or that we can sense as things that are hazardous? I can give you an example. In a hospital, we have maybe water on the floor, maybe tile floors. We have water on the floor, and you have to call. Like I remember one of the hospitals, I don't want to mention, the people that the cleaners are they have this lackadaisical attitude. They're not even, so you can get there, you see water will spill on the floor, things can just go wrong. Nobody's really attending to it. So one of the potential hazards that we can find in a health setting is maybe like water spilled on the floor, slippery floors, or faulty equipment, that can malfunction in the course of its actually being used. So these are some of the things. What are some other risks that we can have in a health setting? Please, who is going to help us, please?
Hello. It's
yes,
Mildred.
yeah.
Can I
Okay,
talk?
Mildred, please do. Thank you. I've not heard your voice for a long time. Go ahead,
Okay,
Mildred.
I've been listening actually.
Okay.
What I have seen that sometimes I see it as disgusting is when you say a hospital or a healthcare facility. Because I've been to one care home in Abuja here. I won't mention the name.
Yeah. Okay.
And when I got there, in fact, from the gate, what I perceived was madness. So I don't know the people that are keeping their parents there. There's people, I saw some middle-aged people that are having issues, mental health and all that. That place is very, very dirty. The environment for the compound, smelling, they are not even taking care of those patients and all that. Then secondly, hospitals. You can go to a hospital for one disease, you carry another one, because by the time you enter their restroom is usually unkept. So yes,
it's true.
Sometimes, yeah, I've gone to an hospital to see a colleague that put to bed. I couldn't hold it anymore. I had to look for the MD of the hospital, the owner, and I took him to his restrooms. I said, "You are a medical doctor. You are the owner of this hospital." Then even I know that you can't use this one is meant for visitors, patients, and all that, but it's not good enough. And the man was angry that day. I'm sure he sacked most of his cleaners because he was bitter. Because I said, sir, once in a while you go around your facility.
Yes.
This building, you are the owner of this hospital. This can make patients, customers not to come. Clients won't come. This hospital, with what I've seen, I can't recommend anybody to come unless there are changes. You have made changes. He now told me, please, I should not speak about it anywhere. I should not mention it. I said, no problems about it. I'll come back and check again before my colleague gets discharged because she had CS. If I come back and it's still like that, I'm going to put it on social media. But that's the only place that people get corrected when you see it. So he now said, So, and that is a private hospital now, ma. If a private hospital, privately owned, I've also been to a general hospital in Abuja here, government owned hospital. Of course, government, now what is their business? So very bad. So diseases can be, some people can get infected from the toilet and the environment of the hospital. Thank you, ma'am.
Thank you so much, Mildred, for sharing that with us. I know it's common knowledge anyway. It's common knowledge. we have seen these things. I tell you, the way I am, the way I feel anytime I've got to talk, I've not even feel that way yet, because we've not gotten to infection control on its own as a topic. Maybe when we get there, you need to take a walk, just as Mildred has said. You need to move into most of these places. That is why these courses, people may think that spending money they may think that having knowledge or paying for knowledge is expensive. Try ignorance. Just try to look at how expensive ignorance would be. You know, most of these people, healthcare practitioners, which we are part of them, and by God's grace, you are also going to be part of the team. You see, many things we do. If you are a health practitioner and you work in such a place, let's not even say you are just a neutral person, you get to see such thing. You know that already it's not for the good of the patient. It's not. So what we are saying is, for us to help nip this infection in the bud, for us to help make our patients remain safe, for us to give them an enabling environment for them to get better, then we have to do the right things that we need. What you have just said, it's funny that that's a private hospital. And like you said, the medical director did not go by himself. He doesn't, that's what people don't understand. A business owner should work by himself or herself once in a while. Look at the environment, look at where the options, look at how things is being done. Don't sit in your high quarters and expect that everybody knows exactly what to do. No, because at the end, that's going to be detrimental to you. Please, the Infinix, can you help us? You are talking into Infinix X6517. I'm trying to remember who is having that. Help us, please. So now we want to look at, thank you so much, Mildred, for sharing that particular thing with us here. So how can we minimize risk? How can we prevent accidents? How can we prevent people having infection? These are some of those things. Risk assessments. How can you mitigate the risk? Some places for elderly people, vulnerable people, you don't have, even if you have an elderly, a mother that is elderly in your at home, you know, you don't, not even mother. No one is really advised to stay where you have slippery floor, because it's very easy. Anyone can just slip and fall, have accident, you know. And as a CHCA, especially if you are working in a private residence, maybe working a caregiver to someone in a residential facility, you have to take note of all these safety protocols, all these safety procedures, you know, ensure that the person is not using a bath. Because now we are trying to do away with this bath thing, bath at top. Most times people that come out of the bathtub, they end up losing their lives if they don't have stability when they come out of it. That is why these are some of the things that we have to be very conscious of as healthcare practitioners. If we are working for people that don't actually know what to do, it is in your place to know what the right things do to help cushion the effect of accidents. Non-slip mats, those mats that are not, and people that are to wear shoes, even you as a healthcare practitioner, you're not to wear shoes. Maybe ladies now, you want to slay while on duty. Like someone had once said, I need to slay, even though I know I'm doing this, I need to slay. And I just laughed in the course of doing my inspection. I was imagining what slaying means when you are handling people that are vulnerable. So even from your shoes, you are slaying, wearing a very high heeled shoes, 10 inches above the ground shoes, and you are a healthcare practitioner moving from patient to patient. Of course, it does not. That's one of the things that can cause, you know, hazards. You wear flat shoes, and shoes that have the cushioning effects. What I mean by cushioning effects, shoes that are not smooth, that can drag you, shoes that have cushioning effect, that will balance that will give you stability as you walk. These are things that you need to. Even with your patients, ensure that you check them from time to time. They don't soil the floor, they don't mess up the bed. Keep everywhere clean so that you will avoid as much as possible. You help to mitigate certain risks, things that you foresee that would happen. By the time we get to mobility, you would see some of those mats, you see some of those things that we need to do. Install railings if you're working in a private facility or even in a healthcare facility. Railings, very, very important. Rails that someone can hold. Maybe someone that is you're helping with mobility. Someone that has mobility issues, you are helping with ambulation movements. let the person hold on to the rails. If the person has to climb a staircase, should hold on to the rails, the bars, those things that are very, very important. We will talk about it in detail when we get to those ones. So, excuse me. Also, emergency procedures too. Quick and effective response during crisis. This is another aspect that is very important. How trained are you? Are you trained? Are you good enough to be able to react, to respond to an emergency immediately? That is where CPR comes in. That is where fire emergencies, how to handle fire extinguishers come in. There are a whole lot of things. As someone that is a CHCA, I tell you, this training is packed. We are going to see how to use, we are going to learn up to the extent of even knowing how to use a fire extinguisher, because some people don't know how to. They just have it there. It's just there. But when there is an emergency, you as the closest to the patient, you as the first person to actually come face to face with any situation, are you prepared? Can you render maybe your patient slumps now, or something happens maybe in the community, on the road, or anywhere you find yourself? Can you spring into action? Do you have what it takes to actually know what to do as a healthcare practitioner this time around, not even as a CAC? So these are things that we need to. Safety is very important. We have to try to learn these things. Ensure that you are well versed with how to use, as we go ahead, how to use a fire extinguisher, how to carry out CPR, cardiopulmonary resuscitation, what to do, because I have seen several situations where there is an issue that could have been arrested in the nip in the bud, that something could have been done immediately. It would have helped that person to stay alive, but because the right knowledge was not available. That's why we talk about knowledge. That knowledge is good to have, any knowledge that you can gather while you can still gather it. It's very important, because I've seen scenarios whereby something happens. For instance, some weeks ago, someone slumped. Just like that, from nowhere, the person just slumped. And when the person slumped in a church, precisely, the person slumped. As that person slumped, people were like shouting, moving to the left, moving to the right, running outside. There was outright confusion. Nobody really knew what to do at that point immediately, because there were no medical practitioners available. And there were even some that actually knew what to do, but they were scared of actually doing what they know how to do, because they have not built that confidence. They have not built themselves to have that confidence to be able to act when there is an emergency, hence this training. So what could have said, do you know, before they could call paramedics and could do this and do that, that was the end of that person, just like that. I mean, just like that. There's a thin line between life and death. And so what matters is to gather the right knowledge, and to act when there is an emergency. Very important. All they needed to do would have been maybe to check that person quickly, carry out the blueprint, check for pulse, check DRAP-C, check everything they need to, check for breathing, for bleeding, check fast, and then straight they carry out CPR. It would have kept that person holding onto the thread of life before the arrival of paramedics, which was not done. So why am I bringing this? As a CHCA, you need to have a good knowledge of CPR, of first aid, how to use the AED, the automatic external defibrillator. All these things, by the grace of God, we are going to learn them as we progress in this training, especially when we get to the practical aspect of it. So it is important that you have to have a list of emergency contacts and already know your hospital procedure or your facility procedure, because each different countries have their own different regulations. And then in different workplaces, care homes, hospitals, they have their different policies. So be vast with it. Wherever you find yourself as a CACA, be vast with it. Know what to do when there are certain emergencies. Know the procedures. Know the actions to take. Clearly marked routes and assembly points. In every facility, there are exit points. If there is fire, there's fire exit points. There are drills. Take part in it. Do not have that attitude of, oh, I don't care, I'm not interested, or this, or show a elusive attitude towards it. No, because don't be surprised. It could be just the only thing is that knowledge that you refuse to get when you had the time to get. So take drills. Extinguishers only know what they are used for, but do you know where they are. Things you have small, because fire extinguishers actually fight small fires. Now, maybe there's just small fire somewhere, and because you don't have the right knowledge, you are confused, you don't know what to do, you add to the fire. So these are things that we need to understand. Where is it located in a medical facility? Where do we keep the AED? That's the automatic external defibrillator. It's actually a machine that is used to shock the heart to come back to pumping when there's a malfunction of the heart. So all those things, let them be in strategic positions and know where they are, because it is one of the things that you have to learn to stay safe in your environment. The PPEs we talked about too, the shields, that we need, all those things, your equipment should be with you, safety equipment, safeguard yourself and ensure that your patients are safeguarded. In you safeguarding yourself, you're also safeguarding your patients. Follow correct procedures for removing PPE to prevent contamination that Madam Ugeze talked about. How do you remove these things to avoid spreading infection, to avoid it being contaminated? It's already contaminated, of course, to avoid it coming in contact with your bare skin or touching another person. How do you dispose of them? Proper hand washing and sanitizing, that cannot be overemphasized. Protocols to isolate infected patients to prevent the spread of diseases. Someone is daddying and mommying. Don't worry, we'll soon be done. We'll soon be done. So that's having said, we have actually come to the end of today. We are going to have some questions that this is practically the last slide. Yeah, it is the last slide. So thank God, like I said, we're almost done. So now let's ponder on these questions. We are going to have the slide, like I said. This is the way we do it. The first 2 days, today, tomorrow, at the end of tomorrow's training, we are going to have the comprehensive slide for day 1 and day 2. That's today and tomorrow put together, dropped in the registered participants group. So you just lay your hands on it and have a follow-up as to what we have learned. That is how we do it. I don't wait until the last day before you have all the slides. No, because you need to keep yourself abreast with what we have learned to prepare for your exams. So you need to ponder on these questions and come up with answers. Why is hygiene critical? In Phoenix, please allow your mother to hear us. Thank you, darling. Allow mommy to hear us. We'll soon be done. So how will you handle a situation where a colleague refuses to follow hand washing protocols? These are things, because you could work with people that would not just want to align with the rules, like Madam Mildred said before. You could have people that know exactly what to do, but have refused to do it, leading to that place deteriorating up to the condition that you actually saw it. So if you have people that are headed, that don't want to align and conform with the procedures and protocols, what do you do? And in your setting, you should ask yourself, what kind of infection control measures should be implemented to contain the outbreak of anything within the facility? So these are some questions that I would like you to ponder, and then you share it with us. Now, what I would like to say before I finish, do not go away, because I'm still here. Even though we are finished, we've gotten to the end of today's training, I still have 1 or 2 things to share. Please, I have observed that a couple of us still go to the general group. Please, I crave your indulgence. As we have started the training, that general group will be locked. If you have any question or any challenge or any issues at all, that is why we have a registered participants group. You can reach out. If it is personal, you can slide into my DM at any time, and then I'll be ready. A teacher, a lecturer is just like a doctor, so you have to be ready at all times, be prepared. So I'm prepared at all times. At any time, drop the message, I'll attend to it. Do not drop anything in the registered participants group. This is for just a confined group for you to now share ideas, and anything at all you can share. That's a group where we can interact, we can discuss, let's have fun. Learning is fun, really. Let's educate ourselves, let's entertain ourselves, and also get educated as we go. So on that note, I think we've come to the end of today's training. I don't know if you actually had value. What I would plead with you to do for me is this. In the registered participants group, because tomorrow it would be closed. I'll keep it open today and tomorrow. please, I need you to put in 1 or 2 comments as to today's training. Like I told you, you know, some people are still doubting Thomases, and you don't blame them for that. It's the way the world has become. So they are still doubting, they are still unsure whether to take the training. The more people we have take this training, the better we'll try to revamp the health sector and do our own little duty in our own different corners. You understand, which will now total into making the world a better place for us all. So please, you can do well to drop 1 or 2 sentences in the general group after this training. Tell them if the training actually worked out. Tell them if you actually learned anything today, because perhaps maybe some people didn't learn anything. I wouldn't know. So just tell them how you feel. It doesn't have to be much, maybe just a sentence or 2, so that they actually know that Andy Smart Solutions is for real, that we are not into all those things that are in the air, that are flying in the air. We are for real, and we are really poised to give you value for your money. So on that note, please do justice to what I have just said. Thank you so very much. Come to the end. So I don't know if we have anything to say. I would like 1 or 2 people to say something, to tell us how today, and I wouldn't want the old people, because the old people have already had their or will I say they have had previous knowledge. I would like people that have just taken this training for the first time. Maybe Mildred is one. Trying to Omolara is also here. Minat is here, as well as many others that I'm not really able to put together their names. So I would like to hear just 1 or 2, and we call it a day, because our time is ticking. Thank you so much. So the floor is open. Who would want to start? Mildred, would you like to start? What stood out for you today? What did you learn today? Is there anything that you want to say before we call it a day? Thank you, Mildred.
Thank you so much, Ma. God bless you so much. I've learned a lot, actually, and I know that all of us in this class would at the end of this course. That's the truth. Not just even for ourselves, hygiene and disease control and all that, you know, preventions. I've actually gotten a lot for ourselves, our family, children, and also take it out there. Whatever we're going to, all the knowledge we're going to acquire, we'll take it out there and make the world a better place. Thank you so much too, that you said you are going to share this the slide to us, you know, so that we can start. Some medical sector. We need to start reading on time so that can get acquainted. Some of us will be eating chicken as we are learning. But now that the exam, everybody is attentive.
Yes, so there is exam. Yeah, we can't gamble with human life.
Thank you so much.
Thank you so much, Mildred. Thank you. So okay. So I think what I have really observed over the years is that we've had more of women on the platform of these health-related courses than men. I know women make the world go round. I'm not trying to be gender sensitive, but I think at this point, Lady Mildred, I would like a man to respond before we call it a day. Please, men on the platform, please. The floor is open. Just a man. Head. Okay, I'm trying to look for a man. It's like we're having really having women.
Ahmed,
okay, Mr. Ahmed, can you bell the cat for the men? Thank you. Since I cannot find any man. Yeah.
You have Sahid.
Okay, Mr. Sahid. Mr. Sahid, please help us. Mr. Ahmed, sir, please can you hold on? Let me ask Mr. Sadiq, because you've passed through this road before. Let me ask Mr. Sadiq. Mr. Sadiq, can you say something?
Yes.
Okay. Please go ahead. Hello, I've lost you. Okay, no problem. It's like we have lost that person. So, Mr. Ahmed, you can help us do justice to that. Thank you. Mr. Ahmed?
Yes, madam, I'm here. I'm here, please.
Okay. Please help us do justice. It's just why I didn't want to hear you is that I know we have we have been friends for a long time on our different trainings. So I wanted a new person. But help us build the cats, build the men. Thank you.
Yes, actually, I would like to ask a question for you to repeat. Let it not look like I was eating chicken anyway, but I was very, very attentive. But I wanted to know what do you want me to talk about, please? Sorry.
Mr. Ahmed. Okay. I was saying that I would want just a feedback from a female and a feedback from a male as to how today's training went. Just one thing that stood out for you, perhaps something you learned or something you did not learn or something you relearned and unlearned. We just want to get a feedback from a man. Since we have heard from a lady, let's be neutral now when we talk about gender. That's it, Mr. Engineer Ahmed.
Okay, thank you very much. So far, I have taken such kind of lecture before, and it is something I'm very, very much interested in. I have learned a lot, especially the aspect of being patient. And what I really take is that aspect of promoting independence. I so much like that aspect, especially allowing or moving along with the person's independent preferences. Yes, like you said. So you see, in healthcare, you have to be patient, like you said. And then I came to realize that some people, sometimes I fall sick, sometimes to an extent where I couldn't be able to do something for myself. But what I wanted to do, this kind of person that is like the soldier that you said, I wanted to be strong for myself, do things for myself. But you see, some nurses, I may not distinguish between the nursing assistant, health assistant, and the rest of them, but we all call them nurses in the premises of a health hospital. They always want to tell you, no, don't do this, do it like this, do it like this, dictating for you. And then that is not helping. I thought it is part of the practice to even, but I come to learn that no, I can be able, or somebody can, who is a patient, can have his independent, and all you need to do is to assist the person. That is very good also. In terms of hygiene and what is it called? Transfer of disease, or what is it called? Yeah, something like that. Sorry about my infection. You see, a lady explained something that I also benefited from. Like she was trying to say something about oral and the rest of it. That's also a very dangerous aspect of it, although we are all adults here anyway. But it's not bad if you do it with your partner anyway in a healthy condition. But you see, what I come to learn again is when she made mention about when the person have bruises and when the other person have on the lips or something like that. You see, I have not taken note of that, but I learned this thing too. So many other things. Thank you. Let me not take much of our time, but I think I have represented the men as well, since the women cannot conquer us. Thank you.
Mr. Ahmed, Engineer Ahmed, we cannot. Who are we behind the decimal points? We can't conquer menu. Okay, thank you so much, Engineer. Thank you very much. It was nice, really, getting to talk with all the professionals, highly knowledgeable professionals on this platform. We would reconvene tomorrow by the same time, 5 p.m. for the next training. Today is just the tip of the iceberg. Just keep your fingers crossed. We are going to really, really learn a lot, and the journey will be an enjoyable one. Thank you so much. And the Smart Solutions, on this note, we hand over to you. We have come to the end of today's training. MJB.
All right, doctor. Doctor, thank you so much. It's another wonderful time. You see why we always call you to come, because you don't disappoint. Participants, am I lying? Does she disappoint?
No, she's very fluent.
No. I really enjoyed the class.
Okay,
Seriously.
thank you so much, our participants. Thank you, Doctor.
No.
All right, thank you so much. We've come to the end of today's class. From us here, MJB Management and Integrated Services, also from Andy Smart Solutions, we say good night to everybody. We'll meet again tomorrow. Bye.
Bye.
Good night.
Bye-bye. Thank you. Good night, everyone.
Bye.
Tomorrow, by God's grace.
Bye. Grace, yeah.
Bye, everyone.
Bye.